this incident was happening in December.
Yeah, that's the coldest month of the year. Well, not necessarily, but
so usually people believe tick bites occur in summer or warmer season, right? But we experience this case in winter, even though Nagasaki is still not so cold, even.
Yeah, the first time I ever got bitten by a mosquito in December was in Japan. So yeah, that was a shocking event in my life. Bitten by a mosquito in December, but it was in Japan, and I took mental note of it. I took a mental note of it because it was a pretty big deal. Where I come from, there are no mosquitoes, and by October, they're all gone. Yeah.
So do you know how many species actually the tick has?
I have no idea.
Yeah, actually I don't know the exact number, but very, very many species that have even a tick in Japan. Maybe Google can or ChatGPT.
Yeah, okay.
I just check quickly now.
Well, what's interesting to me about mosquitoes is that only certain species of mosquitoes pass certain diseases. For example, the mosquitoes where I come from, you cannot get malaria, you cannot get dengue.
Yeah.
But here in Japan, those the tiger mosquitoes, the black ones with the white stripes,
yeah,
they can pass a considerable number of diseases. Dengue, and maybe even Zika.
Yes.
Among others. And then there's a recent disease, I can't remember. What is the recent disease?
Recent?
Yeah, I'm sorry.
Zika, relatively recent.
Well, Zika was maybe 2020. Wasn't that? No. It was
before.
No, it was the Brazilian Olympics, right? I think it was the Brazilian Olympics. So that would be 2016, right?
Yeah, I think so.
But then recently in China, there's a mosquito-borne disease that's affecting China right now.
Oh, I don't know that.
And they're spraying for the mosquitoes.
Okay.
Right now for this disease. And it's those same tiger mosquitoes, the black with the white stripes.
Okay, excuse me.
I could do the research. Chikungunya.
Yes, chikungunya.
Yeah, chikungunya.
Very close. Very similar infectious disease.
It's very similar to what?
Similar virus.
Okay, so if this is the case with mosquitoes, then would it not follow that the ticks would have a similar property depending on which type of tick, which disease can be passed? And I'm not sure that's the case, but it's the logic follows.
Yes, but interestingly, mosquito, even the mosquito, same species can deliver different type of virus.
But then again,
eventually different infectious disease.
Yeah, but then again, some mosquitoes cannot do that.
Yes.
So would that be the case with ticks? That some ticks would be benign and some ticks would be ready carriers of the diseases, depending on the species of tick?
As far as I know, most of the tick can has a potential
Okay, so
But
pretty much
yeah,
they're
tick
all
would be-
bad. There's no such thing as a good tick, I guess.
Mhm.
All right. So did this little girl, she had the tick infestation. Was she suffering any viral disease?
No,
Okay.
actually, she was brought to the emergency department probably just 12 hours after tick bite.
Okay.
Because the tick was already became big after having some blood.
Yeah, the term we use
So-
the term we use is engorged.
Engorged.
Yeah, engorged. So it's a blood meal. The tick is feeding on blood, and the tick becomes engorged, and the abdomen of the insect, is it an insect? I guess it is an insect. Maybe not.
I
Maybe it's
think
not.
it's not meeting the definition. Of
Yeah,
the
it's not an
insect.
insect. It's a pest. Okay, we can just call it a pest.
Mhm.
I think
Mhm.
it's in the like spider family, like crabs and spiders
Yeah.
and ticks and mites. So it's not an insect.
Arthropod, I think.
Exactly. So when the animal becomes engorged with blood, its size increases,
Yeah.
and then it was
yeah.
discovered. So how did they remove the tick? Did they use like heat or cold or?
We have some special tool.
So mechanically removed.
This one.
Oh, okay, nice.
Tick
Yeah, all right. So
twister.
the animal was removed mechanically,
And perfectly. I mean,
completely.
no part of the body.
Yeah,
should not-
completely. Nice. Okay.
Yeah.
So
in
the head
skin.
didn't remain. Okay, great. And
Yeah.
then did you perform a blood test on the child?
No, usually we don't do the blood test just after the tick bite.
Would it not be
We don't do
prudent
that.
to do a blood test because she's at risk for? Why no blood test? I guess that's my question.
Not necessary because there is an incubation period.
Oh, what
Even
is the
though
incubation period?
2 to 14?
I'm sorry, 2 to 14 days?
Mhm. Yes.
Okay. I guess she's being monitored for symptoms, right?
Yeah, of course we did instruction.
The parents are going to
instruct
monitor
the
her for.
parent to monitor
for-
if she has fever or
Yeah,
rash,
okay.
any generalized symptoms.
So why no
Yeah.
why no blood test? That's still mysterious to me. Why no blood test?
What do you want to see in the blood? After the incident, because usually
Oh,
the
okay.
body
So
should
when you say 2
react.
to 14 days, there will be no indications in the blood for at least 2 to 14
Yeah.
days. So you won't get a
Yes.
signal.
Yes.
Oh, I
Yes.
understand now. Yeah. Okay.
Yes. So that's why the time of blood test is just after seeing any symptom develop.
I see. That
After
makes
the
sense.
incident.
Yeah. Okay.
Mm.
So then actually
Usually we don't do the blood test after
Well-
seeing the incident.
the body as a test vehicle, right? As a test instrument will show symptoms.
Mhm.
So the body itself is like a test kit.
Mhm.
So if the body it goes symptomatic, those are indications of the infection. So monitoring would be the prudent
Yeah.
measure. Yeah.
Yes.
Fever, rash, altered mental state. What other symptoms? I guess fever would be the best indicator.
Probably loss of appetite.
Yeah. Okay.
Malaise, any pain of the body.
Irritability. Yeah. Okay.
Yeah.
All right.
So, why I reported this case was 1 year old, very rare. Even very small kids can be
Yeah.
bitten
Mm.
by tick. And winter is very uncommon season for the tick bite. So we
Yeah.
should educate people in Nagasaki or in Japan,
Okay.
pediatric, medical staff, also parents, any people who are involved to see the patient, because the kid was, I think it was bitten by tick in the park, and it was the kindergarten activity.
Mhm.
So yeah, not only for the parents, maybe
Yeah.
any guardian, any educator should know the risk. So
そうです。番号言っていいですか？
that's why I did report this case in pediatric journal.
Yeah, thank you. Now, didn't we discuss a tick-borne disease infection? Maybe was it last week? There was a patient.
Yeah, it was the discussion for the elderly people. This year we experienced 2 severe type of Japanese spotted fever.
Yeah.
It was
Okay.
also tick-borne disease. Yes.
Yeah, I see.
Mm,
But 2 elderly cases in the year.
yeah.
Okay.
Of
course, Nagasaki is a small-
severe type of disease.
Severe, wow. Now the age of the patients was a factor, though, right?
Yeah,
Yeah. Okay.
80 years old.
Yeah. So I guess the very young and the very old would be the highest risk population.
Mm.
Yeah. Okay. Although
I
I wonder
Mm.
if the very young patients would have an actually an advantage. They would actually have a higher survival because of their active immune system and the large thymus and so forth. Maybe the youngest patients are not as susceptible as the elderly.
I think so.
Yeah. Okay.
I think so.
Yeah.
Mm.
Yeah, they got these giant thymus glands, and their immune system has been supercharged by the mother's milk, and they've got these young
For example,
bodies. And,
yeah, I'm not sure. This is a very personal hypothesis, but let's think about, for example, 20 years old or 30 years old, still younger generation. If they develop the fever, probably this is not so common compared to the very young child or
Mm.
elderly people, right?
Mhm.
In this case, we easy to come up the diagnosis, and we can ask specifically, did you have any contact with tick or something like that?
Okay.
But why elderly people become very critical was one of the factors is the delay of diagnosis. As we discussed, the tick-borne disease has a different type of antibiotics
Mhm.
necessary for treatment
Mhm.
compared to the usual sepsis.
Mhm.
So in this case, the patient developed very severe disease.
And this is
also, that's why
viral, not
that's,
bacterial. This is viral, right?
This is a bacteria.
It is a bacteria. Okay. And sepsis
So
is a bacterial infection of the blood, right? Sepsis is bacterial. Yeah. Okay.
Sorry? What did you
Sepsis is bacterial.
No, sepsis is a general term of severe type of infection.
So
Any type of infectious cause can lead to sepsis.
Sepsis can be viral in origin. A virus
Yes,
can
yes,
cause sepsis. Okay.
Yes.
Okay.
The definition of sepsis is infectious disease which complicate any organ failure.
Yeah. Well,
Any type of organ failure.
the layman's term for sepsis is called blood poisoning. I think it's a
It might be,
20th
but
century.
now we can call sepsis even though viral disease, parasite disease,
Yeah.
possible. Malaria can be septic.
Okay. Yeah. I see. It's
Yeah.
it's basically a
Dengue
breakdown.
also, yeah.
It's the immune system has been overcome basically.
Mm-mm.
It's
Yeah.
a break, the systemic circulatory immuno breakdown. It's basically
Mm-mm.
the blood's immune system has been overloaded at that
Yeah,
point,
yeah. I
whether
think
it's
so.
bacterial or viral.
Yes, but
Yes.
quite often the cause is bacterial disease.
Okay.
So bacteremia. So any bacteria is found in bloodstream, blood test, blood culture. So, but in origin, no, not always bacterial disease.
I see. Now, these tick-borne diseases are bacterial.
Let me think. I think not always.
Not always.
I don't know.
Okay.
I'm not
Now,
sure.
the mosquito-borne diseases are typically viral. Is that true?
Mm-mm.
Unless
But
it's
malaria is parasite.
yeah, malaria is actually, is it a multi-celled organism, right?
Parasite.
Yeah, it's almost like an amoeba or something, isn't it?
Yeah.
Yeah.
So that's why not multi-cell. I think.
But it's a very large cellular.
Mm.
It's almost like an amoeba. You know about amoebic dysentery, right?
Mm-mm.
Yeah, that's an intestinal infection
Yeah.
of the GI
Yeah.
tract. Yeah.
Yeah. Yeah.
Evidently,
Oh, yeah.
these the malaria carrying mosquitoes, they die very horrible deaths.
Mm-mm.
Their bodies just basically explode from inside by the infection. From the mosquitoes really suffer from that disease. Poor you kind of want to feel sorry for the mosquitoes, but you don't. You wish they'd all die.
Yeah.
Now here's the next question, and I don't expect an answer. Do mosquitoes, I think I've asked this before, do mosquitoes provide a degree of inoculation in the public? Are mosquitoes microdosing us to pathogens that increases our immunity? That's a question. I don't really expect an answer.
Mm-mm.
There's a speculation. There's been a lot of talk about eliminating mosquitoes.
Excuse me. Sorry.
Go ahead, take your call. You need a phone call? Okay. Son, are you finished with my phone?
Uh-huh.
Okay. Did you take care of it? They said, we can't do that, but last time you did it. Right? How many times have I heard that? There's konkai dake, and then there's konkai dekimasen. I used to get that at the bank all the time. When I first came here, I would get money wired to me from the United States. And then I'd go to a different bank and I'd say, I want money from the United States. And they'd say, we can't do that. I said, the other bank did it. Every place I went to, I had to educate them on how to do that. Oh, welcome back. Are you there, Dr. Aoki?
Yeah, sorry.
Yeah, don't be sorry.
Just,
It's okay. I know you're busy.
No
So,
problem.
so my question
The
is,
question really, inoculation and
well, now the issue is there's been talk about eliminating mosquitoes. Imagine if you could eliminate mosquitoes, if you could use some type of genetic modification
modification, yes.
to wipe out the mosquito population. Would that actually decrease the state of human health? Because it may be that we are being inoculated by mosquito bites. And if we eliminate the mosquitoes, it may be detrimental to human health.
Because basic immunity was affected.
They may be providing us a level of inoculation.
Yeah,
Right.
probably.
Well, this is the problem. If you did this, if as an experiment, you can't undo it.
Mm.
So
But if you are correct, I think the seroprevalence study already shows some basic immunity, I think. I don't know. For example, if the patient has no symptoms, but you are suspecting any low level of virus was
well,
infecting,
there's a
right?
term, it's called microdosing, right? So mosquitoes may actually be providing a very low level of inoculation to the general public.
Yeah, but
And
in
if
this
we-
case, you're hypothesizing like the people had immunity. So
Because
I
mosquitoes are
think-
providing an inoculation.
in such case, maybe we can know the level of antibody. So I think this kind of basic study has been done already.
Okay.
In papers. I don't know the results, but so far I don't know your hypothesis.
Well, I understand that a lot of
Maybe
people.
Japan Sensei can answer some.
Well, now here's a related question.
Mm,
Since Corona, a very large sector of the population wears masks on a general basis. Typically, they wear masks on a daily basis.
mm,
Now, of course, during the pandemic, this was to guard against the infection, and whether it was effective or not can't really be determined because it was during the pandemic.
mm,
Now, we are definitely beyond the Corona pandemic,
mm,
but people still wearing masks.
mm.
Wearing masks, is that negatively affecting public health?
I think there is some study about that.
Yeah, okay.
I don't know the truth.
Well,
But I
let's
think-
get Dr. Hayakawa's opinion. Dr. Hayakawa, what is your opinion of mask use in the general public? Is it good for the public or bad for the public to be wearing masks?
Wearing mask had partially a negative effect
Okay.
for the people healthcare.
Yeah, I think so too.
Mhm.
I would say the ugly people can keep their masks on.
I'm sorry to be late.
Yeah, welcome. Welcome to the class.
I had a important meeting.
Okay. Yeah.
Concern about hospital income.
Mm.
Can you tell us the results? Or is it a secret?
We accepted the many brain infection or brain hemorrhage people. We got the many income
Oh, really?
from insurance.
Wow.
Mm.
But a few people we cannot get the high income from a few people.
Okay.
So
overall, the
if
hospitals.
the patient was severe,
Yes.
we can get the high income
Okay.
from insurance. But if the patient was low and not severe,
Mhm.
we cannot get the
Oh, it's based on severity.
severity.
Okay.
Yes.
All right. So how does this ultimately affect the hospital's budget? Is this good for the hospital's budget? Does that mean the hospital is making enough money to operate efficiently?
Now our hospital led Akaji.
Okay, in the red. So does that mean you want more stroke victims to help you? I'm sorry, another bad joke.
Probably the number of the brain infarction patient is still not increasing and not decreasing.
Stabilizing.
Probably, yes, even
Stabilizing. Okay.
Yes.
So does this mean you'll have to adjust the payment system? Are you negotiating with the insurance companies? Because you can't continue to operate in the red. You can't provide health care if you can't survive as an institution. Isn't it the responsibility of the insurance companies to make sure that you survive as an institution to provide health care? And doesn't that mean ultimately that ratepayers have to increase their payments? You understand the ratepayers, the people paying for insurance?
I cannot explain in English.
Well, I'll keep it simple. Simply, what goes in must come out, right? And if more goes out than comes in, the system fails, right? So in order to maintain the integrity of the healthcare system, the payouts have to be adjusted to the costs. So you may have to demand higher payment for services rendered because it costs money to deliver these services. The insurance company is just an agent. They're not a source of money. They're just an agency. Their source of income is the ratepayers, the people who pay for insurance. So ultimately, in the end, the ratepayers, the healthy working people, will have to pay more into the system to stabilize the system from collapse. But is that sustainable? Are there enough ratepayers and can they afford that? If not, then the system will need to be overhauled into a state of higher efficiency. That's probably the most difficult decision to make, to try to restructure the system so it operates more efficiently. That usually means cutting jobs, but you're also in a manpower shortage. So being in a manpower and a money shortage is very critical for any institution. I don't want your job. I don't have that problem. My company has one employee. He doesn't make that much money, but his expenses are low, so things are okay. How many people work at your hospital, Dr. Hayakawa? Total number of employees.
1,000.
1,000. Yeah, that's big responsibility. That's 1,000 times greater than my company. Good luck.
How about your opinion? OTC drug. Do you know OTC drug, over-the-counter drug?
Do you know the most popular OTC drugs in Japan are Kampo Yaku? Did you know that? Okay.
The number of working people is decreasing now in Japan. So insurance
income is decreasing. Yep.
Is very low.
Yep.
So we try to decrease the medical cost. So over-the-counter drug most frequent.
Yeah. Now in the United States, there's been an overhaul of the drug schedule as far as how much is charged for each drug. For many years, the United States has been subsidizing international drug sales by paying very elevated prices compared to international averages or global averages. So Trump, he signed a mandate to levelize that imbalance so the United States would stop subsidizing the world's drug prices so that the United States would pay a more fair price for these drugs. Now, I don't know what Japan pays for these drugs, whether it's above the global average or not. But maybe Japan needs a similar restructuring in the price schedule of drugs. But moving from prescription to over-the-counter might be part of the solution. Maybe you should use sugar pills. You understand sugar pills? Placebo. More jokes. Sorry. This is a healthcare emergency and I'm making jokes.
How did you say shipper in English? Shipper.
I think isn't that a cold compress?
Cold compress?
Cold, I think that's a cold compress, right? No?
If the patient get the cold compress from hospital, very low cost. But if the patient buys the cold compress in drugstore, takes a high cost.
I see your point. So then there probably needs to be a restructuring of the system as far as who pays for what. There needs to be a restructuring of the who pays for what insurance pays for, what insurance doesn't pay for. Good luck with that. I don't want that job. You have 1,000 people working for you, but how many different drugs are there? Thousands of different drugs, medications, treatments, medicines, IVs, creams, soaps, gauze, masks, gloves. I don't want that job.
Now, all over the Japan, most hospital is low income.
Similar crisis.
Yes.
Well, the topic that we discussed extensively last week was increasing manpower. And Dr. Aoki, you didn't have a chance to talk to Dr. Hayakawa about our manpower, our foreign manpower plan.
Not yet. But
So-
we already discussed same topic several times in this lesson before.
I guess we did. Yeah.
Mm.
So, Dr. Hayakawa, are you open to bringing foreigners into your hospital to work? Bringing foreign labor into your hospital, non-Japanese workers. Are you open to that possibility? Do you have an open mind?
Of course.
Of course. Now, how many, for example, here's an example. I'll try to keep it simple. What if you brought a registered nurse from a foreign country into your hospital? Let's imagine the case where she comes from the Philippines. Let's say she comes from Manila. She's a registered nurse at a general hospital in the Philippines. She relocates to Japan to work in your hospital, but she can't speak Japanese. So how would you limit her duties in order to secure the safety of the patients? What kind of duties would a non-Japanese speaking nurse be given? She can only make beds. Can she give IVs? How would you deal with that situation?
In nursing care area here, the number of the foreign country people is increasing now in Nagasaki.
And in your hospital, also in your hospital?
No. in our hospital, cleaning people.
Only. No
Hmm.
medical professionals.
No makeup and nothing care, not nothing care
Okay.
area. But in Nagasaki Prefecture, most nursing care.
Nursing care, but not hospital.
Yes, yes.
So would there be the possibility of moving these nursing care workers into your hospital as their Japanese skills increase? In other words, they're already, for example, a registered nurse.
But in nursing care field, if the foreign country people cannot speak Japanese, but
Yeah, nursing care is not so language critical as hospital. But language improves over time, especially those living here. So and Dr. Aoki and I discussed this in detail. There would be some kind of a system to graduate these, and they're already professionals. She's already a registered nurse. To graduate them to more critical jobs as their language skills improve. And that you would have a test that's based on their language because they're already a health professional. Now, once we understand the situation for a nurse, how about a doctor? Are there any foreign doctors that are working in Nagasaki? No.
Oh.
Yeah.
For the clinical, I don't think so.
Yeah. And then if you brought a doctor in as an intern, what responsibilities would he have if he couldn't speak Japanese?
Yeah, at this time we cannot give them any responsibility.
Yeah.
Of course.
Almost zero because the doctor.
Yeah.
Yeah. But over time, as their Japanese skills increase, then maybe rotation through EMT, like paramedic duty, because in an emergency situation, you're less discriminatory. You know, he needs a doctor. He's unconscious. He needs CPR or he needs an IV. It's not really a linguistic matter unless you're dealing with the staff, the emergency staff. You know, there has to be a way to integrate professionals into Japan. See, in the West, in English-speaking countries, most people study English. But in Japan, Japan is so isolated because of language. You sent a link, Dr. Aoki? Okay.
I found this is a governmental attempt to invite some Indonesian, Philippine, Vietnamese medical staff to work in Japan. There is inter-country contract, probably. I don't know the details, but there is some attempt to accept not only nursing care, nurse as well.
But higher level professionals, yeah. Okay.
And I don't know. There is a 6 months training for Japanese language.
Indonesia, the Philippines, and Vietnam.
Yeah. And then I don't know.
The number of the nurse from Philippines was 13.
In
13.
Japan or in Nagasaki?
Yes. In Japan.
13. 13. That's
decreasing.
Oh.
Yeah. This is the last year.
Yes, last year.
So 13, 15, 19, 11. But before COVID, maybe already 1, 2, 3 years. 5 years ago, there was 42.
Oh wow, the numbers has been decreasing since Corona.
Mm.
Wow. But then again, Enyasu may be it may be a false correlation because the Enyasu began like 2 years after Corona, so that's a factor. The economic factor of the currency, the fact that the yen is so weak means that perspectives might go to a different country instead of Japan because the money's better.
And also, it might, I think this purpose is providing training. I
Yeah.
think the on-job training, I hope. But
Yeah, I would hope
the
so,
final
too.
goal is they should take a national exam in Japan, Japanese exam.
Before they can contribute anything, that doesn't really help solve the problem because there's the manpower crisis is today is
Yeah, sure.
immediate. And the training
Very-
would prospectively would foreseeably pull critical individuals out of the system in order to be trainers. So that's counterproductive. Do you see my point? If you had to take doctors and nurses offline in order to train perspectives, then they couldn't contribute to the system. This is why OJT is an Iseki Nicho. The OJT, you kill two birds with one stone. They're getting training and they're contributing to the labor force at the same time. Japan has been an isolated system for so many years. These type of international training programs or linguistically based training programs don't exist here. But that's an everyday occurrence in the United States and other countries.
Yeah, they should take a national exam in Japan.
They need to. Whether they should or not is another question. But according to the rules, they need. It's a necessity. Yeah.
But for the training period, like 6 months period, they are providing the Japanese language training. At the same time, they can work in the hospital assisting the nurse.
Okay.
Nurse assistant.
Yeah.
Yeah. And then after 6 months, they need to take a national exam, Japanese language.
Okay.
Oh,
the Japanese language exam, not the nursing exam.
I think no, sorry, not language exam. They should take a national exam
The nursing
in
exam.
Japanese language.
Yeah, good luck with that. That might take years, decades.
Yeah, and then they are allowed to take exams up to 3 times.
Now, can they take the test in English instead of Japanese?
No.
To get a driver's license, you could take the written test in English.
Okay. That's why.
Yeah.
Still, the language is barrier, but
Yeah.
they are providing the training and on-the-job training in the
Yeah.
hospital level. Then they have opportunity to take exam 3
Yeah.
times.
Yeah.
And
Well,
if passed, of course, they can work official nurse in Japan.
I guess in closing, we need enablers and not barriers. Right? Traditionally, Japanese education is a system of barriers that only allowed the most qualified to enter. But the system needs to be restructured into a system of enabling instead of blocking. And it would take another hour to discuss that in detail. So can we delay this conversation until next week? We're out of time, doctors. I'm so sorry.
Yeah, maybe next time.
I hope so. Thank you for joining, Koichi.
We should change the official language to English.
Let's talk about it next week.
Yes.
Okay.
Thank you, gentlemen. I'll see you then.
See you.
All right, bye now. How you doing, Seth? You good?
Hey,
Doing?
I'm fine.
Eating. Tell me your story.
Okay.
Welcome to Osaka.
Eat takoyaki.
You can have mine.
Oh,
I don't like takoyaki. You can have mine. The first time I ate takoyaki was the last time I ate takoyaki.
but how did it? How?
The time I ate takoyaki was the last time I ate takoyaki. No, thank you.
Do you like?
The first time I ate takoyaki was the last time I ate.
Is it? Does it look? Does it taste good?
The first time
Oh, first time, yes.
I ate takoyaki.
I know.
was the last time
Ah,
I ate takoyaki.
you didn't like it?
I never ate it again. One time, that was it. Never again. Sorry. You can have mine. It's like chewing an eraser.
What?
It smelled good. It smelled like a pancake. I was like, oh, this is going to be good. But it wasn't. It smelled like eating a
pancake, not
It
pancake.
smelled like a pancake. I thought it would be good, but it wasn't.
Yeah, yeah.
Osaka's got good food. There's a lot of good food here. Just
Mhm.
not takoyaki. Sorry.
You like the okonomiyaki?
Nope.
Oh,
I like yakisoba. I like yaki udon.
uh-huh. Hakata. Oh, Kokura.
And
Kokura is famous yaki udon.
oh, is that right? And I enjoy samgyeopsal. A lot of good Korean food here.
Mm.
Yeah. What is that? What is that reflecting? Oh, is that the screen reflecting? Oh, I guess it is. Okay. Anyway, are you ready to check homework?
Yeah.
All right, here we go.
Speaking about library,
Okay.
right? You know,
I wonder, are there English books in your library?
my first time, university's library.
Your university's library the first time. That's interesting. So you used to work in Akasaka.
No, no,
I'm very confused.
work in near close to my home.
Where is Akasaka?
Where is Akasaka? Oh.
So you have a new workplace.
No,
You don't have a new.
I
It
work,
says new place. So
not work.
it's
Yes.
so your new workplace or your home
Close to my
here. Near and close to means the same thing. Hey, are we okay? Fumiya, is your new workplace close to your home?
Sorry.
Your old job was in Akasaka?
No. Shibuya.
So, but it says I won't go to Akasaka.
I don't work.
I won't go to Akasaka. Are you there? Hello?
Akasaka.
Says right here, Akasaka. Akasaka.
Akasaka, yeah, Akasaka.
Okay. So I don't understand what you're saying.
Remote place, study place.
Okay, it says your new workplace. And then it says, I won't go to Akasaka. So I'm thinking that your old workplace was in Akasaka.
Yes.
So now you say yes. So which is true? Your old workplace was in Akasaka?
Old place is Akasaka.
Okay. All right. Thank you. All right. You have so and because wrong. What?
Oh, renew. Oh, renew.
What? What is this word? PLASS.
P-A-P-A-S-S.
What is that?
Plus. Plus.
Oh, you mean PLU?
Ah,
Okay.
sorry.
Okay. You're going to use a university?
Yes.
What are you going to do with it?
I am a graduate school student, so I can use another university's library.
Oh, okay.
I have to show the school ticket.
Okay.
My school ticket.
Ticket.
I show it to
Not really a ticket.
staff.
Got it. Gotcha. Coming to you. I hear it.
Thank you.
Thank you. Thank you for waiting. Please read.
Okay. Wednesday, September 17th,
Mm.
I'd like to talk about my new workplace.
Now you work at the university. Do you mean place of study?
Yes.
Yeah, maybe that's better. The thing is, benkyo is like work, but we say work and study are not the same in English. So let's call it, instead of workplace, let's call it place of study.
Place of study.
Yeah, thank you.
Okay.
There you go. Now I understand.
Okay. I'd like to talk about my new study place.
Place of study.
Sorry, place of study.
Yeah,
Place
thank you.
of study.
Good.
My
Commuter pass.
commuter pass
Mm.
expired.
Expired
last month,
Mm.
but I won't renew it because I won't be going to Akasaka anymore.
Okay, I'm sorry, because BECAUSE, I missed the E at the end. My mistake.
Because
BECAUSE, yeah, my mistake.
okay.
Be careful, Fumiya. So and because are opposite.
Oh.
Yep.
Oh.
So
Opposite.
and because are opposite.
Oh,
It's
okay.
a common mistake. It's like exciting and excited.
Oh.
They're opposite, and it's a common mistake.
Yes.
All right, thank you.
Okay. Akasaka anymore.
Mm.
Last weekend, I found out I could use Tokyo University's library because I'm a graduate school student.
Graduate school student where? Not at Tokyo University.
Okay.
Where is your university?
Akasaka, Tokyo Healthcare University,
Tokyo Healthcare University.
International International Healthcare University or something.
Okay.
My graduate school isn't Tokyo University.
But Tokyo University allows graduate school students to use their library?
Yes.
That's very interesting. Is this a new policy?
Yes, new policy.
Interesting. Very interesting.
I can use this library because if when I show my school students pass
Mm.
like staff, I can use it.
Interesting.
Mm.
But undergraduates don't have that privilege. Only graduate and above, right?
Hmm?
Undergraduates can't do this?
Yes.
No.
Hmm? Hmm?
Yes, they can. No, they can't.
Oh, sorry, one more time, please.
Yes, they can. No, they can't.
Yes, they can. No, they can't.
Which one?
Yes, they can.
So undergraduates can use the Tokyo University's library also?
Yes.
So any student, any university student can use Tokyo University's library?
Yes.
Really?
I checked it in on internet.
This is a new
I'm
policy.
Um,
That's very
I'm
interesting.
sorry. I don't know what is the new policy, but I can. I found out.
Yeah. Okay.
I can use it.
Well, congratulations.
Mm.
Yeah. All right. Huh.
So I walked around the library for the first time, and it was very impressive.
Okay.
But I got nervous because it was so quiet that my footsteps seemed too noisy.
Yeah, interesting. Fumiya, this is very good work. Be careful of the difference between because and so. Sorry for my spelling.
Okay.
Don't put a space before the comma.
Okay.
Yeah. And when you rewrite, I think it'll be easier to understand after you rewrite.
Okay.
Yeah. Good.
Place and place of study.
Yes. Place of study.
Study. Okay. I rewrite.
You can also say place to study. Place to study. Yeah. Place of study is more permanent. Place to study is a little temporary, but in this case, this has the same meaning.
Same meaning.
Yeah, sure.
Okay.
All right. Workplace is your job. Yeah. Okay, good. Good questions.
Okay. Actually, my workplace in Shibuya.
Is in Shibuya. That's why we were confused. Because you said workplace, and I thought you were talking about your job. But if you think it benkyo, the Japanese term benkyo, it sounds like you're working.
I checked in English. I checked sagyo.
Well, sagyo. Well, now be careful. We have be careful because I remember my first time teaching in the junior high school.
Yeah.
And I said something, Eigyo Jikan, and they're like, what? I said, Eigyo Jikan Nanji Karas, or something like that. And they're like, Jugyo Jikan. And because I used to be an Eikaiwa teacher at a company. And after about 3 years, I moved to doing public schools. And I use the term Eigyo, but they use the term Jugyo. Right? So we've got Eigyo, Jugyo, and what was your term? Hello?
Sorry.
Can you remember what we were talking about before I interjected with my story? Tell your story again, Fumiya. I'm listening. You checked the English. Fumiya, yes? Yes, I'm listening. Go ahead.
Sorry, I don't.
So you lost your train of thought, Fumiya. You were talking about checking the vocabulary.
Okay, sagyo.
Okay, yes. So sagyo, eigyo, jugyo are different, right?
Yeah. Yes.
Yeah.
So I mistake.
Yeah, exactly. Me too. I got eigyo and jugyo confused because jugyo was for the school and for a teacher. But in English, teaching is a job. So we just call it if you're a teacher, that's your job and you get paid. We don't have a special term for that.
Okay, understand.
Exactly, yeah. So in this case, workplace and place of study,
yes.
we wouldn't say study place. We wouldn't say study place.
Place of study.
Yes, exactly. In fact, I have to be careful here. One moment, please. One moment. Workplace.
Workplace. No.
Workplace is one word, no space. Yeah.
Okay.
Place of study, place to study. Those are 3 words separate. Yeah.
Yes.
Okay. Good. All right. So go ahead and rewrite this one.
Okay.
And if you have questions, ask me next week. Fumiya.
Yes.
So please, on your own, after the class, rewrite this.
Yes.
And after, if you have questions while you're rewriting, highlight them.
No question.
Not now, but after you rewrite, you might have another question.
Okay.
Yeah.
I have a question.
Oh, you do?
I have one question.
About this week or last week?
This week,
Yes, go ahead, please.
I wrote. It looks huge, clean, and intelligent. But
Yeah, so intelligence is for like people.
yes.
Like my professor is very intelligent,
Yeah.
or my brother is very intelligent, or my
Mm.
child is very intelligent, or this animal, dolphins are very intelligent.
Mm,
But a library is an inanimate object. It's a building.
yes.
It's not intelligent.
I should write one word.
Well,
Impressive.
no. So what I did, as I said, huge, clean, intelligent. I think in one word, impressive would be one word to cover all three meanings, right?
Yes.
Yeah. So that was my artistic choice. The word impressive covers those three words. And we can use impressive. My professor is impressive.
Yes.
Dolphins are impressive. The library is impressive. Okay.
Okay.
Yeah.
I understand.
Yeah. Good question. Thank you.
Thank you so much.
Now, when you do the rewriting, make sure that if you have more questions that you ask me next time.
Yes. Thank you.
Do you have any questions from last time?
Last time, no.
No.
Question.
Okay. Yeah. So
Okay.
when you do the rewriting, if there's something that you want to know, make sure you highlight.
Okay.
And then you can ask me the next week.
Thank you so much.
Thank you. Good work.
Okay.
The rewriting is very important.
Yes.
Some people don't rewrite because they're too busy. And I get upset because the rewriting, if the student doesn't do that, I worry they'll make the same mistake again and again and again. I used to do on the computer, like a student would send me like an email and I'd use a mouse. It takes a long time too. That's why I love this pencil, because yeah. But before the pencil on the PC, I would mouse and keyboard
yes.
and then they'd say, sensei, arigato. Like I did their homework for them and they never look again.
Dr. Yamamoto recommend to
The rewriting, it doesn't matter how you write it, but after I check it, you should rewrite it. Because then you incorporate the changes in your mind. You're like, oh, I see, as you're rewriting. And hopefully you don't make the same mistake again. But if the student gets my work and they're thank you, teacher, and they never look again, then they make the same mistakes again and again. Yeah.
Using my hand to study.
Yeah, that's fine. I don't really care whether you use your hand. I have other students they send me like a Google Docs, but then they retype, after I check with the pencil, and then they retype the next page. Yeah. The rewriting.
Every when I write I have to write report. I write to
By
using-
hand.
by hand.
Yeah,
Yes.
okay. That's a personal preference.
Yes.
I don't
So-
care about that. I just care if the student is rewriting. Now, an online lesson, I don't know. I trust you. But when I have a face-to-face lesson and the student hands me their notebook, I can see that they rewrote the next page and sometimes they have a question. Sometimes I make a mistake. They're like, why did you spelled because wrong? Oh, sorry.
Mm.
It's like a double check for me also, because I make mistakes. I try to go as fast as possible. I don't want to waste the student's time. So I'm like Superman speed, and I make mistakes. But then we discuss it, when the student rereads, and then hopefully they rewrite. Some students are too busy to rewrite. Some
Rewrite.
students are too busy to rewrite.
Mm.
They don't rewrite.
Mm.
They just say, "Oh, thank you," and they do the lesson, and then
Mm.
they don't rewrite.
Mm.
And then they make the same mistakes again and again. It's a very long process.
Yeah.
If you think about it, books are huge. They're hundreds of pages. Like the Bible, all these books, big, thick, but each page is very thin.
Mm.
However, page after page after page, after
Yeah,
time,
yeah.
oh, okay, it's a body of work, and yeah.
I correct.
Yeah, and it's a very good back and forth between the
Yeah.
teacher and the student to do this way. So
I collect my research note.
oh yes,
in my
yes,
doctor. When I am doctor.
yeah, yeah. And someday you'll look back at your English notes and you'll go, "Wow, my first English lesson."
Yes. Number 13. Now I use number 14 note in my research.
Oh wow, 14 research notebooks.
Yes.
Wow.
I usually make something on hand a lot of time.
Yeah, I understand. Yeah,
Yes.
that's
Yes.
good.
Ideas so.
It's like muscle memory.
Yeah.
Yeah, it's like muscle memory.
Yes.
Do you know about Unit 731? Do you know about this?
No, I don't know.
So during World War II, the Japanese military was experimenting on humans. They were using humans to experiment. You understand human experiments?
Mm.
So if you're in a laboratory and you're doing animal experiments, you use a white mice or a rat or maybe even a monkey.
I understand. Human.
Don't you know this story?
Maybe I studied
In school.
in university.
Yeah, okay.
About research.
Huh?
How to.
No, this is a war crime. This is a war crime. In the war, they were using humans to experiment.
Before I start to research,
Yes.
I have to learn how to what is the correct.
Oh, ethics.
Yes.
Yes. So they talk about this in the ethics class.
Ethics.
Yes, exactly.
Yes.
Yeah, okay.
I studied
Yes. Famous. Now.
ethics.
Yes, because it's not ethical to use humans like white mice.
Ethics. Yes, ethics.
Ethicality.
Research ethics.
Ethicality.
I have to
Yes.
learn.
Okay. Yeah. Also, the Germans were doing something similar too. The Germans were experimenting on humans. Human experiments. The Nazis, yeah. Yeah, they were using war prisoners to experiment with. Yeah, it was terrible. Okay. Now, in 1945, the war ends. And many of the Japanese military members are on trial. You know about this? The war trials? You know about this? Don't you know about Tojo slapped on the head? Tojo slap.
I know.
You know about this? I want to see. I don't want to see the image. I want to see the video. It's kind of cool. Oh, this is it.
General election. In Tokyo, the trial of the principal Japanese war criminals began this May under the presidency of Sir William Webb. They're accused of waging wars of aggression and committing wholesale murders. One of them is the bald-headed would-be suicide General Tojo. Another is Dr. Shumei Okawa, sitting just behind him. Watch.
Fishing.
Perhaps
Did
he
you
just
say?
like Tojo. More likely still, he hopes to get off by appearing to be insane. But
Okay, anyway.
Tokyo trial.
Yes, exactly. Now, the commander of Unit 731 had notebooks. He had many notebooks. Had lots of data. And he was going to be tried and probably the death penalty for his crime. But he made an agreement with the Americans. He said, I will give you my notebooks if you don't kill me. So do you understand what I'm saying? Can you hear me? The commander of Unit 731 was a doctor. What was his name? I forget his name. I'm going to the Wikipedia page here. What was it called? Nanasan Ichibutai. Yeah, Nanasan Ichibutai, officially known as the Manchu Detachment, Kamo Detachment, Ishii Unit, secret research facility operated by the Imperial Japanese Army. Okay. Who was the director? 200 to 300,000 people. Biological warfare. Oh my God. Chemical warfare. Oh, General Shiro Ishii. He was the commander. And he had many notebooks from his data. Okay. And he was supposed to go on trial with Tojo and the other criminals and would possibly receive the death penalty. And at that time, the death penalty was hanging. Do you know? They tie a rope around their neck. Okay,
Yes.
okay. But he made a deal with the Americans. He made a deal. He said, I will give you my notebooks if you promise not to kill me. No death penalty. So he gave them his notebooks and they agreed, no death penalty. But his notebooks, junk science.
Mm.
There was no value, no scientific value in his notebooks. Do you understand?
I mean, mm,
His notebooks had no scientific value
mm,
because he was a crazy man.
uh-huh.
His notebooks were just like
Mm.
hentai osan, you know. Yeah.
Yeah.
But he
Yeah.
avoided the death penalty because he gave his notebook.
Mm.
A terrible story. Sorry.
Yeah, no sense. Yeah. Mm.
Yeah.
Akira Yoshimura is Japanese novel.
Oh, did he write the story? His story?
Yes.
Yeah.
World War.
Yeah.
His novel so detailed.
Mm.
So I'm interested in this novel,
Yeah.
but sometimes get horrible.
Yeah.
Uh,
Ethics is a very important part of medicine and research and healthcare. Sometimes if a medicine is determined that it's effective, because when you do trials for medicine, it's very
medicine.
medical trials are very difficult topic
Yes.
because ethicality.
Mm.
Now,
Yes.
in a trial, you need control groups, right?
Mm.
Some control groups get salt water.
Mm.
They don't get the medicine.
Yes.
And the experimental group gets the medicine, and it's double blind or whatever, right?
Yeah.
If it's discovered that the medicine has positive efficacy, you must stop the experiment and give the medication to the control groups. Do you understand that?
Yes.
You can't, like, let's say it's a 6-month study or a 1-year study. If it's determined at any point in the study that the medicine has positive efficacy, you must stop your research and give the control groups the medication. Yeah. It's a very difficult field of study, medicinal efficacy and ethics, and
Yes.
yeah.
So I learned.
Yeah.
Yeah.
We learned from the mistakes of history.
Yes, ethics, medicine ethics
Yeah.
is so severe.
Yeah. Strict.
Yeah.
Yeah. Very strict.
I don't have any medicine, so ethics level.
Yeah. But when I think maybe like, isn't cancer research the most critical? Yeah, when you're doing cancer research and new medications, things like that, ethicality becomes a big issue. But for you, physical therapy, then again, I imagine that some therapies have been eliminated because they were not good for the patient. I think in the United States, there's a large debate around chiropractors. In Japan, I think, what do you call it? Seikotsu?
Yes.
It's very,
Yes.
chiropractic, yeah. It's very common. It's covered by insurance. But in America, there are many doctors who are against chiropractor because they feel it's injuring the patient. What is your opinion? Do you have opinion?
Yes. Chiropractic.
What do you think it's good for the patient or bad for the patient?
Actually, I don't know what the chiropractic is. So I Now, actually, I don't have any opinions.
Well, my wife suffers chronic back trouble,
Mhm.
and she visits the chiropractor very often.
Mhm.
And her opinion is it depends on the practitioner. A good chiropractor is good for your body.
Mhm.
A bad chiropractor is bad for your body.
Mhm.
And she spends a considerable effort finding the good,
Mhm.
the good chiropractors. Like when we moved here from the other city, she had a hard time trying to find, it took her many months to find a good practitioner. And then she goes to the same person
Mhm.
as a repeat because she does not want to be manipulated by the bad,
Yeah.
not very scientific.
Mhm.
A medicine is a medicine is a medicine. Aspirin is aspirin, and Tylenol is Tylenol, and it doesn't really matter who the doctor is as long as the dosage is 5 milligrams, 10 milligrams. But chiropractic is very subjective.
Mhm.
It depends on the person.
Mhm.
And this is one of the reasons why America rejects it and doesn't cover it in insurance,
Mhm.
because it's too subjective.
Mhm.
It's not objective enough. It's not scientific enough.
Oh,
Yeah.
in America?
They don't. Chiropractic is not part of the insurance plan. It's not an official treatment.
Mhm.
Yeah, it's not. But in Japan, it's covered under insurance.
It is chiropractic is something same similar to physiotherapist, but
That's what I was
physiotherapist
getting at. Yeah. So
can't do rehabilitations because I have to go through the doctor, and doctor doctors go sign. I have to get doctors go sign
approval.
Yeah,
Approval. Yeah. Yeah.
After approval, I can use
Okay. Yeah.
my hand.
Yeah. And
Maybe.
a good physiotherapist
Mm.
and a bad physiotherapist, a bad physiotherapist could actually injure the patient.
Yeah.
So it is very subjective.
Mm.
Yeah.
Mm. Yes, I think so. But some of physiotherapists don't approval from doctor.
Are you talking about black market physiotherapists?
Gray zone.
Gray zone. Yeah. I
In
see.
Japanese, how to say how do I say 保険外 in English.
Not covered by insurance. Not covered by insurance.
Yeah. Not covered insurance.
By insurance, yeah.
Therapy.
Yeah.
Is many in Japan.
One of my students,
Mm.
in fact, Sumiko was a patient.
Yeah.
She was having problems with her shoulder.
Yes.
His name is Dr. Osugi,
Mm.
and he does this off insurance therapy to improve circulation.
Mm.
And it's actually very effective, but it's not recognized by the medical profession. It's not covered by insurance, but he has many repeat customers and he's written 11 different books, and I'm helping him translate his books, and I help him with his English pronunciation so that he can give lectures.
Dr. Sumiko Yamamoto, yes, go to rehabilitation.
Dr. Osugi. Yeah, it's circulation therapy, they call it. Yeah.
Now, today.
I think she's okay now. When her shoulder was really bad, she was getting therapy from him. But he's only in Tokyo like once or twice a month, and she needs it every week. And his students, and he even says that, my students are no good, he says, because the technique is too subjective. If you're good, you're good. If you're bad, you should not even, right? It's such a subjective skill.
There are a lot of subjective
Yeah.
skills.
Yeah.
Yes, actually, I have to get, but it is not.
Economical.
Yeah,
Yeah.
I can't use. I can't my assessment in number.
Oh yeah, it's not quantifiable.
Quantifiable.
Yeah, it's not quantifiable. It's anecdotal. The patient maybe say, "Oh, I feel much better." What does that mean? Also, quantifiable. Some test methods are very quantifiable, like CT scan or MRI scan. But one test method that's very subjective is the ultrasound. You know ultrasound US? Ultrasound US. So like a pregnant woman can't have x-rays. So they use a special ultrasonic. It's very subjective depending on the operator. Good operators can make great diagnoses, but a bad operator might miss a blood clot or a birth defect or something. Yeah.
How to handle
Yeah. It's very subjective. It's not as quantifiable as CT scan or MRI. Yeah. But that's life. Cooking is subjective. English is subjective. Right? Hopefully we have choices. You know, oh, I don't like that restaurant. I'm not going back. Oh, I like this restaurant. I'm going to be a regular customer.
Yeah.
This is why I don't charge a Nenkaihi. I don't charge a new Kaikin, because if my student is not happy, they should be able to quit anytime. So I work hard to try to keep them satisfied. But some schools, they charge a Nenkaihi every year. And then they charge a new Kaikin, or they charge, extra textbook programs and all this extra fees and Tesudio. No. Simple, flat rate. You like it, you stay. You don't like it, please go. And I'm happy. My students are happy. So, but it is very subjective. Very subjective. Quantifiable.
One of my friend is physiotherapy in an owner, and
he has his own clinic. He has his own private clinic.
Yes.
Okay.
He owns clinic. So he use many quantifiable assessments.
Okay.
To and explain what is best, what is better
Okay.
quantifiable assessment
Okay.
is any. So patient trust him.
Okay.
Mm.
However, some of those quantifiable assessments are questionable.
I think so. Yeah. So many people, many physical therapists write report.
Yeah.
Uh,
But then again, in the end, you know, customer satisfaction, patient progress is the ultimate determination. You know, can they walk now? Are they improving? And ultimately, you want them to leave your therapy, right? So that they can go back home and they can do their job or work and do their housework, right? And you've enabled them. And then you move to the next patient that needs the critical care. But hopefully, you want to say goodbye to them as they gain independence.
So my teacher taught me I have to do it many times.
But in my opinion is that you will develop a personal relationship with each patient in order to do the right thing. And these quantifiable standards are kind of in the way, you know. Like many times, especially the parents, they'll say, I want my child to pass the ACAN test. Can you teach the ACAN test? And I'm like, oh, I have to say yes, because then they'll try to find another teacher. The reality is, if the student studies English properly, their test score will improve. I don't teach the test. I teach English.
Test.
In fact, in Western culture, teaching a test is the mark of a bad teacher. We never talk about teaching the test because it's unethical. But in Japan, teaching the test is the teacher's job. So that's the cultural divide. So every time they say, do you teach the test? I'm like, oh, of course not. Oh, yes. I have to say yes. If the student's English is improving, their test score will improve. I don't teach tests. I teach English. But I can't say that to the parents because then I won't get the job. Yeah.
Be careful.
Yeah, gotta be careful. But ultimately, it's your patient, your student, their needs, and you're there to help them the best you can. Yeah. Fumiya, great discussion today. Great work today. Do you have any questions?
No question.
We're on the schedule for next week at the same time.
Okay.
Thank you very much. I'll see you then.
Thank you so much.
All right, take care.
Thank you.
Whew. Nice. Should we leave those chairs in here? Oh no, carrying them around is exercise. Maybe we should put the weights. You know, look. Scott, see the zipper? This is for hiding the money. We should put the weights in there. Put 5 kilogram weights. So that carrying them around is harder.
Money pocket.
Hide the drugs in there. Officer, don't open that zipper. Daichi, how are you?
Hi, I'm good.
What's new?
I don't know, like I have this. Oh, I think I said it before, but they have this choir contest.
Oh,
Yeah,
you have to sing a Japanese song?
yeah, and it's pretty hard because I don't know the meaning. It's like kind of like the old Japanese words.
Yeah. A lot of people, like I speak Japanese, but I don't sing Japanese songs. And I know a lot of good Japanese singers that don't sing English songs because it's too hard for them. It's just different. Just because you're a singer doesn't mean, and you speak two languages, doesn't mean you can sing in the other language. Because singing in a foreign language is a very different thing. It's almost like you need a different brain. Yeah. I really encourage my students to sing English songs because it helps their English speaking and pronunciation.
Oh yeah.
Because English music has a lot of great idioms and the pronunciation and the rhythms. When I first came to Japan, I kind of understood that. I was hoping to get interested in Japanese music. And if I started singing Japanese songs and I was very interested in the Japanese music, that would help my Japanese language. But I don't like Japanese popular music. It's just not very good. I have my personal favorites, you know. It's hard to. A lot of Japanese songs are just copy. They just copy the popular sound of the Western song, you know.
That's kind of
I think Japanese say pakuri. You say pakuri.
Oh.
Yeah, I don't like that. Many times, you know, I go to the karaoke bar and somebody says, "Oh, I want to do this Japanese song," and I'm like, "That song sounds just like this other song," you know, an American song or a British. Yeah. So I'm not very impressed by the Japanese pop music. The Enka singers are kind of amazing. They do some amazing things. But I don't want to sing Enka.
I also don't like really listen to like Japanese songs. So.
Yeah, I don't either. I mean, there's a few that I listen to. I know people that love the anime songs and stuff, like Evangelion or Uchusen Yamato, that kind of. They can sing that song, you know. Kind of corny though, because all that stuff was back in the 70s or whatever.
It's kind of like weird.
It's kind of corny music. It's not really
Yeah.
Some of the American music or the British music or the Australian music's pretty amazing. Canadian music. My son really likes Canadian music.
Oh.
Yeah. Do you sing at karaoke?
Well, like I don't like really sing, but
yeah, it takes a lot of practice to be good at it.
Yeah. Like for some reason, middle school, like junior high school students can't go to like karaoke.
Well, with their parents, they can in the daytime, right?
Oh yeah.
Yeah.
With their parents, yeah. My parents are usually busy, so I can't really go.
Well, karaoke is actually a great way to study Japanese. It's too bad they don't let but you know, you get in the karaoke box and people want to smoke, and and drink alcohol because it's on the menu. But they've changed a lot of that now.
Oh yeah.
Like a lot of places have a special smoking room. You can't smoke in the room, which I like because I don't like being in a room where the smokers were. That's cool.
Oh yeah.
But then again, if you need to order alcohol, you got to go down to the counter or something. You can't get it brought to you in the room or whatever. I don't want to do karaoke anyway. I want to sing in a band. I want to sing with musicians. So some bars don't allow smoking. Some bars do.
Yeah.
I really don't like the smoky bars because it hurts my voice. So.
Oh yeah. It kind of like makes your voice kind of like raspy.
Yeah. So I like the non-smoking places, but the people aren't as fun.
Oh.
The smokers are always more fun people. It's always a more,
They're
more
like,
it's
like
always a
shit.
better time in the smoky places. Some of the places have a smoking room,
Oh.
and like I need to talk to the guitar player or something. I'm like, we got to talk about the next song, and he's like, I gotta smoke, so I follow him into the smoking. I last 5 seconds in there.
Dang.
I got to get out of there. There's like 5 or 6 people in the smoking room. I'm like, put your cigarette away. Just go in there and breathe. Save some money. So bad.
Oh yeah.
Some people think I'm silly because I love Starbucks. They're like, that's not real coffee. They don't have Starbucks in Italy. There's better coffee. That Starbucks is so commercial. And I'm like, I love Starbucks. I mean, the coffee's really good. Okay, maybe there's better.
Oh yeah.
I don't know where. Maybe there's better coffee, more realistic,
Oh yeah. Like the-
Italian blends. I don't know where the better coffee is. But when Starbucks came to Japan about 20 years ago, maybe 25 years ago, it was the first non-smoking establishment in the country.
Oh.
Every other place I went, I go in the McDonald's, people are smoking cigarettes. I go in the Eikokuya, they're smoking cigarettes. Any students say, let's meet at the Eikokuya. Starbucks, no smoking.
Oh.
And that was, like I say, about 25 years ago.
Oh yeah.
And so I've been a fan ever since. I love the Starbucks Summer. Thank you for coming to Japan. Thank you for starting the non-smoking movement in this country. Because when you go into the Starbucks, the people were like younger, more progressive. You go into one of these other cafes, it's like, it's like the kind of people you don't even want to be close to, let alone talk to. But you go in the Starbucks, people are young and fresh and non-smoking, and so they got jazzy music, and
Yeah.
so I'm a friend of Starbucks. I think Starbucks helped advance the trend of the non-smoking venue, and it's almost like, especially after Corona, a lot of places just no more smoking.
Oh, was it like after Corona though?
I think that was kind of a turning point for a lot of places to decide, you know what, we're just not going to have smoking in here, or we're going to add a smoking room.
Oh,
Of course,
okay.
now there are places that the whole building is a non-smoking building. So people have to go to the place around the corner, or they have to go to the balcony on the second floor. I get in the elevator of this one building, and I see somebody going to the second floor. I'm like, yep, it's a smoker. They're going to the second floor so they can smoke.
Oh,
Because there's no place in the building to smoke other than the balcony on the second floor.
yeah.
And on the wintertime, they're out there freezing their balls off, because they want to smoke. I'm like, yeah, whatever. I just got to
Does
stop.
that mean
I got to stop at your floor. I'm late, and I got to stop at the second floor so the smoker can get out the elevator.
Oh yeah.
Take the stairs. Oh, no, that's too healthy.
Yeah, they're like, what's like worse, like vaping or like smoking?
Okay, so one of my students is a doctor, and well, I have many doctors, but one of my doctors, right? I'm not sick, but I have a lot of doctors.
Oh, yeah.
Every 5 minutes, I'm like, Koichi, you got to quit smoking. And he's like, but my stress, and I can imagine his stress because doctors, it's a very stressful job, you know, stressful job and stressful hours. And, you know, and for him, smoking is his only chance to relax. And I said, can you please switch to the electronic cigarettes? You know, the vaping or whatever, right?
Oh,
And he did. And now he doesn't cough in the class.
oh,
And so, from my personal observation, that the vaping is not as bad as the smoke.
oh.
Yeah.
I don't like the pipes, like the old,
The water pipes?
yeah, like
You mean the old-fashioned, like Bing Crosby pipe, like the MacArthur pipe?
yeah.
I shall return. I mean,
That's like the worst like version of like cigarettes, right?
well, I think the electronic cigarettes are not as bad for you as the smoking the cigarettes. So, yeah. But why do that anyway? I know people that drink non-alcohol beer. Why? If I go in the shower, I don't take an umbrella with me.
Yeah.
So why are you? Yeah. So what's the point? Aren't there better things to drink that don't have alcohol in them, like grape juice or something?
That's a valid point.
Hey. You know, I know people that do the bicycle machines.
Bicycle machine.
Yeah, you know, like the sports club has the bicycle machines where you get on the bicycle machine.
Oh,
right.
Yeah. Oh.
And we had this when I was at university. We had this new sports center. They built this new aqua center with the Olympic swimming pools, and they had the exercise machines. And my buddy says, "Yeah, let's try out these machines." And I've been bicycling since I was like third grade. Of course, we're in college now, and you know you can listen to your lecture on the headphones while you're on the bike machine or whatever. And okay, so we get on the machine, and I'm like, nothing's moving. I'm sitting in one place. I'm putting all this energy out. There's this meter going up, but there's no wind. The buildings aren't moving past me. I'm not going anywhere. Forget this. I'm the first time, last time on a bike machine.
Oh.
If I'm going to be if I'm going to be busting my ass, pushing my legs around in a circle, I want to go someplace. Right?
Yeah.
I want to go to like the top of a hill so that when I get to the top, I can and coast down the other side.
Yeah.
The payoff. I want that payoff after the workout.
It's like
Yeah. Bicycle machine. What? No, thank you. No, thanks. All right. You did a homework.
Oh, I think I sent.
I got it. Let's check it out.
Oh, okay.
Let's check out the homework. What happened to your camera?
Oh, just as
It's okay. It's okay.
make sure that I.
Yeah, you sent it. I got it. I saw it before you joined.
Okay.
Can you see my screen?
Oh yeah, I can.
Nice. Assassinations, Lord Almighty.
Yes.
Daichi, did you watch the assassination of Charlie? Did you see the video of that?
But it was blurred. Like
Oh, it was blurred. Okay, I'm glad
The
because
bullet entry part was like blurred.
yeah, I saw it and it was very shocking.
It
And
was pretty good.
well, I wouldn't want young people to see that, you know.
You just imagine. I
Yeah.
kind of feel bad for his like wife.
Oh, you have to.
Like her,
Yeah.
and like his own daughter. So, yeah.
Yeah, that's so sad. We can talk about it, but you know, I can't recommend that you see that. You don't need to see it. We can discuss it. We could discuss it in detail, but you don't need to see it.
Yeah. It was.
I'm a grown man, and I did not enjoy watching that. In my, I had
Too realistic.
Well, I'm ex-military, and I had nightmares about it. You know, so it's like I I don't recommend anybody watching that, but we can discuss it.
Oh, yeah.
Discuss it. Assassinations are common. I'm going to say that political assassinations are far too common.
Okay.
Not a period, but and. Far too common, and they usually end up in tragedy.
Oh, yeah.
Ooh. Switzerland's 30-year war.
Yeah.
We don't say carnival party, we just say carnival.
Oh, it's like the.
It's like mug cup. Is it a mug? Is it a cup? Right? It's a mug, it's a cup.
Yeah.
It's not a mug cup. A carnival is a party that has meat, basically. Okay.
Oh, okay.
Right. That's what it means. Carnival is like a feast on the meat. And they have other activities. They got beer, they got darts, they got games or whatever. Okay. Yeah. Okay. Town carnival.
Okay.
He eventually killed. All right.
Okay.
Sounds like you got it.
Yeah.
What is that kanji? That's so interesting.
I don't know.
That's interesting.
I
Is that like
did the
onori or
the
something?
gravestone. Like I don't know why. I just
It looks like a gravestone. Is that the kanji you wanted?
no. It's like I just simply entered a
So what
gravestone
does that
emoji.
kanji mean? Does it mean gravestone?
No, I don't know. It kind of looks like it, though.
Yeah, that's maybe it's emoji bake, I guess.
Oh,
What is that kanji character? While I'm fixing this, find out what that kanji is.
okay. Oh,
Yeah, the Soviets will reach out and touch you. The KGB lives. It's scary. I don't want to be Vladimir Putin's enemy.
Okay.
Some people wish they weren't Donald Trump's friend.
Well,
Well, right? Friends and enemies, gee. Sad.
yeah.
Sad. Here we go.
Okay.
All right.
On Thursday, on September 18th, assassinations.
Political.
Oh, yeah. Political assassinations are far too common, and they usually end up in tragedy.
Mm.
Here are some facts about the world's most unusual assassinations.
Let's say end in tragedy. We don't need to say end up. We can just say end in tragedy.
Okay, political assassinations are far more common, and they usually end in tragedy.
Mm.
Here are some facts about the world's most unusual assassinations. 1. Georg Janosch.
I think we will call him Jurg.
Jurg?
Yeah, the Y.
What about the, is it?
I think it's
Janosch,
Jurg
okay.
Yenach. Sorry.
Oh, it's okay. So, 1. Jurg Janosch was a one-time preacher who went on to be a politician and leading figure during Switzerland's 30-year war.
I'm sorry, Daichi, but when was Switzerland's 30-year war?
Oh, it was like in the 1970s.
Huh?
Hold on.
Holding
Let
on.
me just search it up real quick. Oh, 1618 to 1648.
Yeah. Because to tell you the truth, Switzerland has been a neutral party in the last two world wars.
Oh,
So evidently, the Switzerland 30-year war was in a bit distant in the past.
oh yeah.
Yeah, because like I say, in the last two world wars, they've been a neutral party.
Okay.
Yeah. Do you know about the Geneva Convention?
Oh, yeah.
Yeah, and it was held in Switzerland because during the war, it was a neutral location.
Okay.
All right.
During the town carnival, a group joined in. Their leader wore a bear suit, and he eventually killed Janosch with an axe.
Let's delete the word he. We don't need to say he. Their leader wore a bear suit and eventually killed
Okay.
Janosch. Yeah. With
yeah.
an axe. An axe murderer in a bear suit.
Yeah.
In the 1600s?
Yeah.
Man, that's medieval almost.
That's pretty weird.
Brutal. Did they say what his motivation was?
I don't know.
I don't either.
Like,
Okay. One-time preacher, the head of the Mooney Church. You know about the Mooney Church, right?
Mooney Church.
Remember the guy that shot Abe in Nara?
Yeah. Oh yeah.
Evidently, his mother had given a bunch of money to the Mooney Church,
Oh.
and he was angry.
Moonies.
The
Okay.
Moonies were somehow linked to the Japanese political party of Abe.
Oh. yeah.
Yeah. The leader of the Mooney Church was a Christian minister in North Korea. And when North Korea became communist, religion is illegal in the communist in a communist country. Religion's illegal. Did you know that?
Oh yeah, I knew.
And so he was thrown in prison for being a preacher.
Oh. Okay.
And the prison he was in, the Americans thought it was a military base and they bombed it.
Oh.
And in the bombing, I guess they blew one of the walls out. He escaped. And he escaped to South Korea where he started preaching again.
That's a whole story.
And then Abe's grandfather saw how powerful he was at drawing a crowd of people, that he brought him to Japan to help them gain popularity in their political party.
Oh.
So the connection between the head, Sum Young Moon was his name, and the Japanese Jiminto is very old. It goes back to the Korean War. Yeah. But Sum Young Moon, I'm pretty sure he died of natural causes. He was never assassinated.
Oh yeah.
Yeah. Okay. Preachers and politicians.
Oh yeah.
Okay, please continue. Thank you.
Okay. Charlie Kirk, confident of.
We say confidant because it's like a French word, so we use French pronunciation. The word cafe.
Oh.
Yeah, we don't say cafe, we say cafe.
Okay.
So we pronounce this word confidant.
Confidant. Okay. To Charlie Kirk, a confidant of Trump, was shot and killed during a speaking engagement at Utah Valley University on September 10th, 2025.
How sad.
Yeah, that
was very sad. Okay. Any questions?
No, I'm good. Yeah. 3. Bulgarian dissident.
Dissident.
Okay, 3. Bulgarian dissident Georgy Markov was waiting for a bus on Waterloo Bridge on September 7, 1978. When he felt a stab in his thigh, Mr. Markov looked back to see a man with an umbrella escaping into a taxi. Later, when he finished his day at the... It got 2 those.
Oh, sorry, that's my mistake.
I can just do
this. Sure, exactly.
Later, when he finished his day at the BBC's Bulgarian service, he went home because he was feeling sick. 4 days later, he was found dead in his own house.
Wow.
It was later discovered that he'd been injected by a ricin.
Ricin.
Ricin. It was later discovered that he'd been injected by a ricin tipped umbrella.
Yuck. Ricin is a very poisonous substance. It's like a nerve agent or something, right?
Yeah, I think,
Yeah.
Rest in peace, Charlie Kirk.
Did you find what that Chinese character
is? It's it's called what was it? Eki, and it means benefits and gains. So
why did the Moji Bake pick that character? Does it have anything to do with a tombstone?
I don't know.
Is it something that you would say like our condolences to your dearly departed loved one or something? No. It's just the computer going weird.
Yeah.
Okay.
In my screen, it's like the emoji. It's kind of like made out of like a square. It's
okay.
Like and it turned into a square.
Yeah, that's so weird. I think it's AI being stupid again.
It's pretty weird.
Which is common. Any questions here, Daichi? Any questions?
No, I think I'm good.
Escaping into a taxi. Yeah.
Oh yeah.
The getaway car.
Just,
Where to begin? All right. Have you followed the Charlie Kirk story at all since he died? That was a week ago.
oh no.
So evidently he was wearing a titanium plate on his chest.
Oh,
And the bullet, I thought it was strange because I watched the non-blurred version.
it's like his neck, right? Like,
I watched this non-blurred version and I saw him get hit by the bullet and it was like a shockwave went through his chest. And I was like, that's so strange that his whole chest went like a shockwave went through his chest. And I thought this bullet had entered his upper chest into his heart.
oh,
But I watched a YouTuber later that analyzed it. And what happened is I didn't know he was wearing a bulletproof vest. He was wearing this hard titanium plate vest.
okay.
And the bullet hit the very edge of the top and bounced up into his neck.
Oh,
And when it did, the plate went boing. And that's why it looked like this shockwave moved through his chest. It
Oh,
was
yeah.
that
I was like-
plate bouncing around.
yeah.
And when it went up, it basically went into his brain and he was instantly killed.
Damn.
He was dead. I mean, he didn't know. Hopefully he didn't suffer.
Oh yeah.
Of course, his heart is still beating and all that blood is rushing out.
Oh yeah.
Now, the question is, if he hadn't been wearing the vest, the bullet would have destroyed his heart, I guess.
Yeah.
It would have went into his, I don't know. I don't think he would have been any better. Of course, dead is dead.
Oh, yeah.
If the bullet had landed a little further down on the vest, it might have bounced off in a way that wouldn't hurt him.
Oh yeah.
But there's a lot of people talking about how safe those kind of vests are. The
Oh,
other kinds of vests are much thicker and they actually absorb the bullet instead of letting it bounce off. Because
yeah.
having the bullet bounce off is actually very dangerous because it could hit you in the face and like it
Yeah,
did.
why didn't they use like a bulletproof?
Well, they
vest?
didn't. He didn't want to look like he was wearing armor,
Oh. yeah.
right? He didn't want to look like he was afraid or like he was, you notice like the Secret Service people that surround the president, they're not wearing helmets and machine guns.
Oh yeah.
They're dressed in suits and their guns are hidden underneath their coats
Yeah.
because it doesn't provoke. It doesn't provoke. If you walk up to a stranger with an angry look on your face, he might run away scared or he might punch you because why is this guy? But when you walk up to a stranger, you smile, right? You
Oh
just
yeah.
walk around the city. I feel like shit today, and you just smile anyway, right? It's kind of the way it is. President walking down the street, he wants people around him wearing suits. He doesn't want a bunch of guys in helmets and machine guns walking around with him, unless he wants to project an image of war, right? No,
Yeah.
he's like, hey, we can do business. Come to my office. Let's talk. And these guys are all like clear, they got the thing in their ear. They got the gun hidden in their coat. I saw one video where the one guy's arm wasn't even real because his actual arm was on the gun.
Oh.
And the other arm was like this fake arm
It's like a prosthetic.
because they wanted they wanted to be able to pull their gun out really quickly if they needed to. And walking around and having to stick your arm in and pull, it's two movements and it might take time. And
Yeah.
some YouTuber like analyzed the video. Why has this guy got a phony arm? And then he talked about it, how his hand is really on his gun. But the image is one of, I'm just a guy in a suit. Maybe I'm his secretary. Maybe I get his coffee for him when he has me, that kind of image. In reality, these guys are trained killers.
Oh yeah.
They don't wear suits when they train,
Yeah.
They jump over logs and they jump under things. They rappel off buildings and with helmets and machine gun. They're ex-military or whatever. They're
Okay.
They're Secret Service agents. But when they get the president duty, they get the suit, they get the thing in their ear. Everything's got to look like
Like the
cool.
sunglasses.
Yeah, it's like nobody's gonna get hurt. We're all friends here. This is what we call decorum.
Decorum.
Decorum is kind of like the, being polite.
Oh.
Non-threatening. Yeah. So he didn't really want to look like he was ready for war. He wanted to look like a guy on a college campus wearing a t-shirt. And I'm sure his friends, his family, his security expert was like, Charlie, you got to wear this thing, man. We don't know who's out there in the crowd. You got to wear this. He's like, okay, I'll just wear that. Problem is, a good shooter is going to try to make a headshot.
Well, was the killer trained?
He was probably aiming for his head.
Damn.
And he just missed the head, but it bounced off the vest and went up into his neck.
So he wasn't really trained.
No, when you're that far away, you can't really guarantee where that bullet's going to hit. When I was training in the military, from 500 meters, I had an 80% chance of hitting a basketball.
Oh.
Well, a head is smaller than a basketball.
Oh yeah.
So you're not going to aim for the head. You're going to aim for the middle of the chest because you want that one bullet to count. Let's say you actually hit them in the shoulder or something. They're going to drop their gun or they're going to dive for cover, and all of his buddies are going to go, where'd that come from? And you got to leave because you just took a shot. So you want that one shot to at least do something, even if it hits him in the shoulder. If it does what it's supposed to do, it's going to hit him in the chest. It might accidentally hit him in the head. It's one less soldier to worry about. And you're not going to bring at somebody like that unless they're going to shoot at you, right? I don't want anybody if I'm in a combat situation, I don't want anybody closer than me than 300 meters.
Yeah.
I want them to be between 300 and 400 meters away from me. We train at 500 meters.
Oh.
So that we are, when they get to 4, we know we're going to be able to hit them. But if they get closer than 400 meters, you need to be packing up your gear and moving away because you don't want to be that close to other people with guns.
So immediately combat.
You don't want to get that close, right?
Yeah.
I noticed at this event there were so many cameras, and there was one camera that was like, "Oh, look at all the people," and you could see the sniper right, and then nobody noticed it.
Oh,
You could see the sniper up on the roof, and they didn't notice till after they looked at the video, and they're like, "Wait a minute, there he is!"
Yeah.
But at the time, nobody noticed it because they're look at all these students that want to ask Charlie Kirk a question.
Oh yeah.
And that was his decision, ultimate decision. Okay, I'll wear armor, but it's got to hide underneath my shirt
Oh yeah.
because I don't want to look like Mr. Combat. I don't want to look like Mr. Gun-loving deer hunter guy or whatever, MAGA right wing. I want to look like a college guy. Right? I don't want to be threatening to these students. I want them to feel comfortable when they come up and ask me the question. Okay, let's take a guy in full combat gear, sit him in the middle of the campus. I come up and ask him a question. I don't want to ask that guy a question.
Yeah.
Mr. Combat Gear? Why is he wearing that stuff? Are they going to shoot him? I don't want him to hit me.
Yeah. Oh yeah. That's fine.
Think of the danger to all those students.
Yeah.
Think of how many innocent people could have been killed. You do know when Trump was shot, 2 people died. No, I'm sorry.
Oh.
1 person died, another person took a bullet and then recovered. I don't know if they fully recovered, but I think
Okay.
two or more innocent people were injured and one man died.
Dang.
Yeah, Dan.
That's
It's really sad. We should
it's-
be
it's
able.
like- It's like a,
Abe, Trump, Charlie Kirk. These guys are just talking. They got a microphone. They don't have a gun. What's up with
yeah,
that?
they just yeah.
I mean, if a guy, I was trained to shoot the people that had guns because they were going to try to kill me.
Yeah, it was like for survival.
And I was trained by shooting at pieces of paper. There was a big piece of paper that was 500 meters away with an outline of a guy on it, right?
Yeah.
And yep, if there's a guy that's trying to kill you, then you get a chance to stop them with your gun before they get close to you. Okay, I can understand that.
Yeah.
But if he's got a microphone, I'm like, maybe he's a bad singer. I'll just go to the next bar. If I don't like what he's saying on the microphone, I'll just leave. Or maybe I'll get a microphone and say, you're wrong. I'm not going to get a gun. That's crazy.
Yeah, it's kind of like they kind of like took it personal.
Well, some people think it was a conspiracy.
Conspiracy.
Some people think that this man was paid or was
Like the
coached
John
or
Blair
encouraged into doing this for political reasons by another party or another
Government.
faction. Yeah, that's some people say it was a conspiracy, and other people say no, just one crazy guy with a gun. It's too easy. I don't know what the truth is, and I guess he's not talking.
Oh,
They've been
apparently,
asking him questions for over a week, and
Oh,
he's not saying anything.
okay, yeah. That's sad.
Then you come to a country like Japan that has virtually no guns. One guy orders parts on the internet and builds a gun to kill Abe. I guess he
Yep.
really wanted Abe to die.
He was that desperate.
America is full of guns. There's guns everywhere. People keep them in the back of their truck. People keep them in their glove
It's
box.
like Walmart.
People keep them in the drawer next to their bed. They keep them under their pillow. They keep them in their closet. They keep, right? The guns all over the country. And yeah, people get shot. But here in Japan, what? Crazy old man with his katanas cutting up his neighbors, call the police. That happens. That happens.
Oh yeah. It's like knives, right? Like
There
most
are
of
crazy
the-
people in this world. That's another thing. It's estimated that 1 of every 100 people are crazy. Psychopath. Right? They don't need a reason. They're crazy. Give them a gun. Oh no. Who knows what they'll do.
Damn. Yeah.
Right?
That's why, like in the U.S., it's like having guns are like normal.
The chance that a crazy person has a gun are much higher.
Oh yeah.
But in Japan, a crazy guy, he'll use a car or a knife to kill somebody, right?
Yeah.
I guess in Chinese people don't have guns.
Oh,
But there's
okay.
this rash of car violence where somebody loses their mind and they run their car into a bunch of school children.
Damn.
Have you heard
It's
about
like-
these stories?
Oh yeah. It's like it's kind of like a hijack. I mean, like
Well, it's called, what is it called? I forget what it's called. Well, the term is vehicular homicide, when you use your vehicle to kill someone.
yeah.
Yeah. A car is a deadly weapon. If the
that's-
police in the United States, if the police tell you to stop and you don't stop, they could charge you with attempted murder because
Like
you
a-
didn't stop your car.
4th degree manslaughter.
No. Fourth degree is an accident. Oops,
Oh.
I forgot to tighten the bolts on the brake.
That's,
Oops.
oh yeah.
It's vehicular it's vehicular homicide. Not vehicular manslaughter would be like an accident.
Oh,
Vehicular homicide is
They
you
did it
used
on-
your
on-
car
deliberately.
to kill someone. Yeah. And if the police are standing there and they say stop, and and they're standing there, they're not in their car. And they're standing there and they say stop and you don't stop, and they catch you later, they could charge you with attempted murder because they had to jump out of the way of your car because you didn't stop when they said so. Because a car is a deadly weapon. Yeah. That's why only licensed people can drive. It's like only doctors have to have a license before they cut you open because a knife is a deadly weapon.
Oh yeah.
But if you have a doctor's license, hopefully you can save their life, right, with the knife. Okay.
Yeah.
Crazy guy with a knife, look out. Doctor with a knife, save my life. Cut the cancer out, please.
Oh yeah.
Please, doctor. I hope you have a license.
Oh yeah. It's like having like a license hard. Is it like difficult
To get a
license?
doctor's license, it takes years of school. It takes like over 6 years of school
yeah.
to get a doctor's license.
It kind of like depends, right? It's like if you want to be a surgeon, like it's gonna be like more harder than the.
Well, you know, being a doctor, doctors have specialties. Some doctors only prescribe pills or do tests like psychologists,
Oh, yeah.
psychiatrists and things like that, right? Okay. But surgeons cut people open to save their life. Yeah.
Yeah, I feel like being a surgeon is more harder than the normal doctors. Like the pill.
Well, to just be a doctor is a minimum 6 years of school.
Yeah,
And then
so-
you have years of what we call the internship where you're working at the hospital at the lowest level, learning all
Oh, it's like
the
the
things.
it's like
you
the
need.
resident.
Yeah, you go from intern to residency,
Oh yeah, yeah.
right? And depending on which specialty, but all the first basic 6 years is pretty much the same for everyone.
Oh,
You get to cut the dead bodies open. You know what they do?
oh
They
yeah.
call it cadavers, where you actually cut open a dead body. You
Yeah.
have to do that, right? If you don't want to be a doctor, it doesn't matter what. You guys still got to cut open a dead body if you want to be a doctor.
That's
Do you want to be a doctor?
no. That's gonna be it is gonna be hard because
Now you could become like a professor, a PhD. You could be a doctor of mechanical engineering or a doctor of, chemistry or something, right? If you wanted to.
it's like a scientist.
Yeah, that's what they call a PhD.
Oh,
A doctor of some philosophy, like engineering or science.
oh yeah.
But an MD is a medical doctor.
Oh yeah.
Yeah. Mm.
That's what like people call like scientists, like doctor or something.
Yeah. Because the guy's a gearhead. He designs like landing gears for stealth aircraft, and he's a doctor. He doesn't cut people open.
What about like medics? Are like medics doctors?
No, they're not. They're EMTs,
Yeah.
emergency
it?
medical technicians.
Oh,
They're what we would call paramedics.
oh, okay.
Yeah. In fact,
It's like
well,
that's
the
what
thing
we're
a
trying-
paramedic would do, we got to get this guy to a doctor. He's going to be the one that helps you survive on your trip to the hospital. They're
Oh,
called
yeah.
they call them the first responders,
Oh yeah.
and they're the ones that stop the bleeding, get the IV in, get you in the vehicle, get you on the road, so that the doctor can
Yeah.
save your life. Yeah. Sometimes there's doctor cars and there's doctors out on the street, but they're usually in the hospital.
Yeah.
Would you want to do that? Would you want to work at a fire station? And
Fire station, probably. If it was like a fire station, yeah.
yeah, and
Well,
then you
like a
would be
doctor is gonna be.
not a doctor,
like
but
mentally hard,
would
so-
you want to be an emergency medical technician?
Yeah, probably. I think I can do that.
Yeah.
Yeah.
I should have done something like that. When I joined the military, I should have.
Oh.
Instead, I wanted the big guns, It's kind of stupid. I had so
It's
many
good, it's
chances. I should have said, yeah. I should have said I wanted to be a jet mechanic or something, or instead of
Oh,
they stuck me in with these big guns and big loud boom boom thing.
what about like the ground operators, like in the airport? Like the
Oh,
guy
like
that
air
brings,
traffic,
like, their-
air traffic control,
Yeah.
or which you're a flight line. What is it called? What do they
It's
call
like-
that? The guys that work the flight line.
I've seen that in like the Top Gun.
Yeah, those. I think did we talk about it? The grape juice and the yellow guy and the white guy and the red guys. Yeah,
Oh
they all
yeah.
have different jobs. Yeah. I mean, a lot of those guys end up doing that. They didn't know what they wanted to do, and maybe they liked it once they got the job, but it wasn't like I want to be the guy with the green shirt on. It's really,
Yeah.
Of course, those are the mechanics. If you really like being a mechanic, right?
Yeah.
If you to do anything well, you have to work hard at it, and so it
Yeah.
needs to be something you like to do. Right. Otherwise, you're just a normal dummy, like convenience store, 1,080 yen an hour the rest of your life. Nobody wants that. Who wants that? Nobody.
Yeah.
So, what is it that you like to do?
I like simply like like building games.
Yep. Are you
Like-
coding? Are you coding now?
Oh yeah, I'm doing the basic like I forgot it's like all made too. It's like we do it we can do it at school. It's like
Are you using a tablet or are you using a PC?
it's a PC, yeah. We have like this computer lab, like there's a
Nice.
PC, so like
And are you actually typing the code or are you just like moving blocks around and arrows?
oh
and
it's
things?
kind of like blocks, but you can sometimes type. It's like well if you want to like advanced version, it's like you can type.
Yep, just keep rolling with that.
Yeah.
The more you work on it, the more deeper you get into it, and the more involved you get with it. And then
Oh,
you start asking the AI to help you write the code, and you oversee it, the outcome, and all that stuff. Yeah, because that skill is very necessary. But like I say, if you want to be an expert at it, that people say, yeah, call Daichi, we need his help. It takes.
Oh,
I don't want to say years. I want to say hours, but it takes years.
yeah.
It does. But if that's what you like to do, then hey, I'm getting paid to do something I like to do. Wow. A lot of people can't say that. They're like, oh, I hate this job, but I need the money. That's so sad.
Oh yeah.
I hate this job, but I need the money. That's so sad. Keep up the good work, Daichi.
Oh, thank you.
Do you have any questions?
Oh no, I'm good.
All right, don't forget the rewrite.
Yep.
You can always send me a message if you do have a question.
Oh yeah.
Next week, same time.
Okay.
I'll see you then.
Okay. Yep.
Take care.
Take care. Bye.
Oh, one more. What are we doing for dinner, son? Are we going out? Am I gonna have to cook something? What's happening for dinner? What kind of meat is there? Are there pork chops left? Should I make pork chop shin ramen? You don't want shin ramen, do you? Think about it. I got one more hour. Oh, the tomatoes came.
That's tortilla.
Oh, there were just more tortillas? Boy, the floor's cold. You better stick them in the fridge. Stick them in the fridge. dinner plan, man? What's the dinner plan, man? You want to go Kentucky Fried Chicken? Oh, it's gonna rain. Well, if we got enough food here, we're cool. Welcome back from Tokyo.
Yeah, thank you very much. Yeah. Tokyo is a very hot city, and
This week has been hot.
yeah, so the
Yeah.
last week was also too hot, and
Yeah.
in that time, so it was heavy rain, so the Shinkansen was stopped.
Oh no!
Yeah, so maybe the whole hour was 5 hours.
Did you buy ice cream?
No ice cream. No,
I
but
think that's when they sell the most ice cream, when the train gets stopped.
yes, so stop. Now it's stopping. No service.
Did it disturb your schedule?
Distribute the
Did it mess up your schedule? The train stopped. Did you miss your meetings?
Yeah, that's no problem. So the
No
come
problem,
back to
okay.
Osaka, come back to home. So
Oh, you were up.
yeah.
Okay.
So maybe another 4 or 5 hours. So they too late.
But then again, the power was on and the air conditioner was working, so you were comfortable in the train, right?
Yeah.
And you had a Wi-Fi connection.
Yes, no.
Yeah, because sometimes, like, if the power goes out, you got no air conditioning. You can't open the
Mhm.
window because it's the Shinkansen.
Yeah.
People start running out of water. The toilets are full. That's scary.
Yeah.
But you
Yeah,
were
it is,
okay
yeah.
then, yeah.
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 That time. So the next. Sorry. So at first, I want to confirm the next schedule, please. So
Okay.
and,
Yeah, let's talk about the schedule.
Maybe the next week, I also to go to Tokyo. So
Yeah, let's look at it. Let's look at the schedule.
Wednesday night.
All right, so here we are. So you're telling me that September 25th is difficult?
September 25th. Yes, September 25th is difficult. So,
Okay. Would you like to move to September 23rd?
So, it is better than in this last next week. Monday is 何日なの
Monday's very difficult for me. I'm sorry.
Sorry. So Tuesday is a national holiday. So
I'm working.
yeah. So the thanks for working.
Are you okay at 7:30 on Tuesday the 23rd?
23rd. 23rd is I was very I 火曜Yeah, 23rd is no problem. So,
What time is the best time for you on the 23rd?
So
Because if you want an afternoon
every
lesson,
time is okay.
would you like a
Okay.
lesson at like 5 p.m. or 4 p.m. or something like instead?
Sorry. So that time the not available. So maybe the 7 or 8 p.m.
How about 7:30?
7:30 is no problem.
Yeah, I'll move you to 7:30.
Oh, yeah.
Okay, great. Thank you.
Sorry.
Don't be sorry.
Okay. Yeah.
All right.
Next schedule is 7:30, please.
Okay. Why so busy? Why so many trips to Tokyo?
Yes. So very busy. So yeah, that's a very attractive. So very good feeling. So because new atmosphere, new environment. So it's a very.
You like Tokyo? Remember how terrible things were during Corona? We couldn't go anywhere. We couldn't do anything.
Yeah,
We're
yeah.
trapped in the house.
Yeah.
It's nice to get out. It's motivating.
Yeah. So now is the Tokyo's hotel is very expensive. So last week I stayed at Tokyo, so it's a very expensive.
Too
So
many tourists.
because of the now is do you know the World Athlete Exhibition in Tokyo? Do you know that?
World Athletic.
World なんていうかな、ワールドアスリート、陸上、ランニング、なんていうんだろ
I don't know about this event.
う。
World Athletic
Athletic
Competition Exhibition.
The ceremony, not ceremony, athlete
Exposition, maybe.
Exposition. Yeah.
Exposition. So lots of tourists.
Yeah, so the many tourists, so
Yeah.
it will be higher than usual. So maybe the next week also expensive.
Yeah. Yeah. Corona was nice because the hotels were discounted.
Yeah. I think so.
Yeah, and you could go anywhere, and there was always empty seats everywhere.
Now my company supporting the fee in hotel is about 15,000 yen.
So that's the limit. If it's more, you have to pay the difference.
15,000 yen. So
if it's more,
I cannot find such a price to the hotel. So now,
so you have to pay the difference.
We stay at Yokohama, Shin Yokohama.
You have to pay the difference.
Yeah.
If it's more than 15,000, you have to pay the extra out of your pocket.
Yes.
Wow.
So maybe I will stay at Shin Yokohama another year. So.
Which is far from your location.
Yes.
Yeah. I'm really hoping they tax the tourists. Tax the tourists. Please start taxing the tourists. We need the money, right? And we also need a little relief on our infrastructure. The trains are too full. You can't get a reservation. Right? So if it brings the number of tourists down just a little bit, and it generates money for the community, that's a good thing. What's wrong with the Japanese government? They got no sense. Tax the tourists.
Yeah.
Good idea.
Good idea. So
but they don't change. What's wrong with these people? I don't understand.
So recently, so the many money sport is
tourist attractions.
Yeah, tourism.
Like Kaminari Mon.
So
Tokyo Skytree.
Yeah, many tourists.
Tokyo Tower.
Yeah, so it's a very big problem for such a place. So the
Over tourism,
over
just too
tourism,
many
so the-
people. Yeah.
And yeah.
Well, my biggest complaint, the
Mhm.
Mito Suji has been converted.
Converting.
You know, converted. You know the Takashimaya?
Yeah.
It used to be a bus turnaround.
Oh.
They used to have a taxi lane
Mhm.
and a bus turnaround. It's all
Mhm.
plaza now,
Mhm.
which is nice because you got picnic tables and chairs and people can hang out. It's just a big public plaza. There's no more cars.
No more.
That's nice.
Mm,
You know how the Mito Suji has the main road and then the two side roads?
Yes.
Once you get to Shinsaibashi, the side roads are gone. They're bicycle paths now.
Bicycle. Oh.
But
Mhm.
the people,
Mhm.
and it's not just tourists, the Japanese people too.
Japanese.
They just walk in the bicycle lane with their phone in their face and their families and holding the girlfriend. And I'm like, excuse me, I'm on a
Mhm.
bicycle. Ding,
Mhm.
ding, ding, ding. And they're like, oh, those are, it's not just the tourists, it's the Japanese people too.
Yeah.
They don't see bicycle lane. Hello.
Mhm.
They just think they can walk anywhere. They don't, yeah,
Mhm.
whatever. I should not
Yeah.
complain, but
But recently, so the bicycle lane is increasing, so the
yeah, but people don't follow the rules. They walk in
Yeah,
the bicycle
yes.
lane. So it doesn't help.
Yeah.
It doesn't help. They just walk in the bicycle lane like they can walk anywhere.
Yeah, but Shinsaibashi area is a lot of the people, a lot of the tourists, so
Day
it's a
and
very-
night.
Mm.
And we're talking midnight, the Chinese people with their small babies after midnight. I'm like, this is so weird. It's like 11 o'clock at night, Chinese people pushing their little child around Shinsaibashi at 11 o'clock at night. That's what they do.
It's dangerous.
Well, no, in Japan it's safe, I guess.
Yeah.
But it's kind of a thing they do in China too. After dinner shopping is kind of a family hobby for Chinese people. I remember the first time I got to China, I got to my hotel and I didn't have shampoo. I forgot to pack my toothbrush. I needed to go to the grocery store and get a toothbrush and toothpaste and some shampoo, right? And I asked the manager, I said, is there a grocery store open? She's like, yeah, down the street. Okay. So I went down the street, shopping center. Like it was like an Eon, but it was in China, right? I don't remember the name. I go inside, and it's late at night. It's after 9 p.m. Entire families. The children are in their pajamas. It's after dinner. The grandparents, the grandchildren, the parents are all shopping. It's like what Chinese people do after dinner. They go out and shop. It's not like Japan at all. Japan, after dinner, it's you stay home, you do your homework, you get ready for bed, you brush your teeth, pack your landau.
It's unique, so the
Chinese
Japanese
people
don't go to the
do their own thing.
outside. After
Night market.
Mm.
I remember, like Sunday night at 10 p.m. in Shinsaibashi, everything just closed.
Shut close.
Not now. It's open all night long. The Don Quixote and the Dotonbori, it's go all night. Yeah, it's a very different place.
Yeah, especially such area is also the very, very
Never sleeps.
and crowded, so the very, very
Never sleeps. Yeah. Tax those people, please. We need the money.
Yeah.
The teachers need more pay. The roads need to be fixed. Saitama. we need the money. Tax them.
Yeah. So the out of the people in Saitama, so the out of the illegal.
Well, the road work, the sewer, the
Mm.
holes in the road, we need to fix the infrastructure. We need to tax the tourists. Maybe Takaichi will change the.
The next prime minister.
Do you think she can win?
Sorry, I don't know. I cannot judge.
I hope-
Maybe the Koizumi-san or
Oh God!
Koizumi or
Please
Takagi-san
no.
is the primary or secondary candidate. So but it is very difficult. to,
Difficult. Yeah.
which is good or not. So maybe the Koizumi-san is a very famous, very popular. So maybe if the Koizumi-san will be prime minister, the Jiminto can get the vote.
Well, Hatoyama
Next
was
section.
popular.
Hatoyama is
He was
so
popular, but he lasted 6 months, and the nation went.
Yeah, but the nation is so the gradually. So yeah. So,
Somebody was
Mhm.
telling me that Takaichi was actually the architect of the Abenomics. It was her plan.
yeah.
That's
Very
interesting.
Right side of.
She was the one. She was the planner. It was her vision. It was her. She was the architect.
Okay.
Kenchiku.
Kenchiku.
It was her plan.
Takaichi-san is a Nara prefecture.
Is that right?
Yeah.
Yeah.
So maybe that tomorrow or the day after tomorrow, so Takaichi-san announced that so that I want to be the prime minister.
Okay.
So that yeah, maybe the next week.
But-
tomorrow.
It's not our vote. I mean, it's not the people's vote. It's the party's vote. See, in America, we vote for the man, and the man votes for the party. Right? The party comes with the man. We vote for the man or the woman. Right? But in Japan, the people vote for the party, and then the party selects the leader. So it's not our
yes.
decision.
Yes.
But if they want to win again, maybe they should put a woman in there, because wouldn't more women vote for Jiminto as the prime minister?
Yeah, for the first time. So
You would hope.
that if the Takaichi-san will be.
I think you would
Okay,
get
fine.
lots of women votes if you did that.
Yeah. So if the opposite parties put together, so the one person, one candidate votes to but the Jiminto is not the majority now.
Well, if they want to get their majority back, they need a popular leader. So.
Yes.
Yeah.
If Koizumi-san will be.
Oh, I see. But
can-
it's hard
prime
for me
minister.
to imagine that Koizumi would be more popular.
Yeah.
This is why I thought Hillary Clinton was going to win against Trump, because in my mind, every woman would vote for her, and some of the men would vote for her. So if every woman votes for her, that's 50%. And if some of the men vote for her, then she wins. But evidently, Hillary Clinton was not popular with the women. Many women didn't like her.
Why is not so popular in
Her attitude, I guess. Right?
arrogant and
Yeah, exactly. Yeah, she had this arrogant attitude, and a lot of women didn't like her. So she didn't get all those votes. She didn't get 50% of the vote. Of course, it was a pretty close election. The Clinton-Trump election was really close.
ヒラリー・クリントン and versus トランプis so the very なんていうか it's a very strange and very unique fight.
Yeah.
It's a very interesting.
Yeah, well, Trump is a unique person. Yeah. But you would think that Jiminto would put the women up there to get more votes, right?
Yeah.
In Japan, it seems to me that Takaichi would get most of the women voters, right? Is she too right wing? Is she too conservative?
very, ishizu.
Takaichi, you know. So what is women? What does your wife think of Takaichi? Does your wife like Takaichi?
So I don't know.
Does your see we always talk about politics.
No.
One of the worst times in American family is the Thanksgiving, because the Thanksgiving is at election time, and people get in fights. The father-in-law and the sister and the mother and the grandfather and you kids. The fights during Thanksgiving dinner over politics. But in Japanese people, they don't. Their families don't talk about politics. So. Yeah. Different culture.
Many Japanese people are not interested in the elections.
Well, Japanese politics is pretty boring. American politics, oh my God.
Yeah, it's
bring your helmet.
Very so interesting.
Bring your bulletproof vest.
Why such an enthusiasm, such an election? Sometimes I check the news on the TV.
Life and death.
It's a very enthusiasm.
It's life and death. It's life and death. I mean, at the very beginning of the United States, we tore away from the British Empire. We were tired of being taxed by England. We wanted to be our own country. And if you talk against the king, it's the death penalty. 250 years ago, if you said something bad about the king, you could be killed for it. It was totally within the law. If people were speaking bad about the king, the military come to your house, take you away from your family, and hang you in the public square. That was happening. Americans were being killed for saying bad things about the King of England. So our country tore away from England. It meant war. From the first day of the United States, it was war. Our country began with a war. So, happy birthday. I mean, that's America. The war never stopped, really. Japan is a very different history, very different culture, very different story.
Historically, it was very different from the Japan and the USA. So
in a way, the beginning of Japan, when you talk about the beginning of Edo, was really the beginning of Japan. Because before Edo, it was Sengoku, it was Tosahan and Kyushu and all these other not countries, right? And it wasn't Japan. It was all these factions fighting warrior clans and samurai. And Tokugawa was the first one to unify. And it was peace. No more war. War stopped. So Japan basically began with the end of war. And 300 years of no war. That was Japan. Where America began with a war and then war. Japan began with the end of war. So, in simple terms.
From Edo, so we don't.
No war. The end of the war.
Domestic.
In fact, fighting, the samurai's job was to go around and stop people from fighting, right? And if people were fighting, well, better not fight. You don't have a sword, he does. Peacemakers.
This is very good.
I just wonder how popular Takaichi is with the women. I wonder if people who don't agree with Jiminto, if Takaichi was the leader, they'd say, "Oh, we've got a woman prime minister. Okay, I'm going to vote for Jiminto next time." I wonder.
Maybe I think it's the main reason is she is because she is a woman, so that it's a main reason. But maybe her policy is a very very conservative, very conservative. It's so that now is so that very unique. So that because so that now is so the Japanese people is so the liberal is the mainly. So the insist her policy is very unique. So that we are attractive to her policy and her
Okay.
touch. So that it's a very interesting for us. So he's gradually become popular.
Okay. However, I think there is a lot of sexism in the Japanese traditional. I don't want to say government because the companies, that generation, the older generation are very traditional and they're not very progressive when it comes to women. It's like, what do you call it? Sei sabetsu? Against women. Because she's a woman, they don't want her to be in charge. So there's that factor. Yeah, so it's difficult. I think if Koizumi is prime minister, it means that the government doesn't care what the people want. Because most people I talk to say Koizumi is not intelligent. He should not be prime minister. Right? And if the government puts him there, it's like they don't care what the people think, which means they don't care about the people. I mean, I know that because every time the economy went down, they'd raise the sales tax. Right? I mean, you really don't care. You just want the money. People aren't paying tax. Let's raise it. You're going to kill the economy. They do it anyway. They went from 3% to 5% to 8% to 10%. I'm like, what are you doing? The economy's sinking and you're raising the tax? Didn't you go to a high school economics class? They don't care. They don't care about the people. If they cared about the people, they would have gone easy on the tax. They would have stopped at 5%. So that's good enough. We can't raise it anymore until the economy approves, and then we don't need to. No, they just kept raising it. Oh, wow, these people don't care about people.
Yeah.
And if they throw Koizumi up there, that just shows that they don't care about the people.
Yeah.
If the economy improves, everybody wins.
Yes.
All of this talk about gay marriage and all of that very left-wing stuff or non-conservative stuff, I don't care about that. I don't care what their name is on the mailbox. I don't care if there's two. I just want a better economy, right?
Yes, everyone is.
And then you can do what you want. You can marry whoever you want. I don't care who you kiss. I just want the economy to improve, right? Let's put someone in there. I don't care what they think about gay marriage. I just want a better economy.
Yeah. I think so. Everyone is so that the economy is very important for us.
But there are a lot of people whose mind is focused on, I think, the wrong goal.
But recently, so the ankete,
polls. We call those the polls.
Polls.
Yeah, the polls. Yeah.
The number one is the economy. Everyone is concerning about the economy, but so the second is the defense of the defending power of the Japan.
So then, isn't Takaichi the person for that? She has economic experience with Abe, and because she's conservative, they're pro-military. So, if those are the two biggest concerns in the polls, then she's the logical choice, right? What is Koizumi's policy on the defense, on the military?
Sorry, I don't know.
Maybe nobody knows because he has no opinion. Maybe he doesn't talk about it.
Yeah, so I don't share the
Yeah.
Koizumi-san's policy for the defense. So, but the Takaichi-san is said that so there is she don't like the China.
Well, now here's the issue. These polls, all of this information, how much is real? How much of this is the Chinese influence, the Chinese government, propaganda? They're controlling the media. They don't want a conservative pro-military in there. They want Japan to stay weak. And they're going to make the right person look bad with what we call spin. They spin the story. Right? Here's an interesting example. Last week, a very conservative man named Charlie Kirk was killed at the college campus.
Utah University.
Okay.
Yeah, I know.
And the first news story to come out said, we don't know, maybe it was a Trump supporter's guns in celebrating. Do you know what I'm saying? Okay, so now have you ever seen like Osama bin Laden? Remember Osama bin Laden? Remember? Okay, and he'd walk up to his soldiers and they're like, Allah, Baba, and they're shooting their guns in the air, right? Okay. The news was saying that the shot was a Trump supporter shooting his gun in the air. They didn't want to take responsibility that it was a left person that killed Kirk. They spun the story. You see what I mean? They'll take a story and they'll spin it so it sounds like it comes from another direction. There was a picture with a picture of the shooter showing a Trump shirt. Somebody used CGI to turn his shirt into a Trump shirt. They wanted people to believe that it was a Trump supporter that killed Trump. That's what we call spin. So the Chinese would spin the story like, oh, you don't want this Takaichi person because she won't let the gays get married or won't let you change your name, and you don't want that. The propaganda machine. Because they got the money. They got money to control media and pay journalists to write these spin stories to make themselves look better or to make the person they want to win. You know, that they said that's how Trump won, that the Russians paid Facebook. Right? They paid Facebook to get Trump elected, and that wasn't true. But that's the story they wanted people to hear. Yeah, so it's a jungle of information. It's like, what's true? Who's what?
I cannot believe
Who can?
that.
Who knows the truth?
It's a not truth.
It's old information overload, and then not all of it's true.
It's very difficult to judge. Okay. Good or not, judge okay or not. So it's a very difficult.
You know, Trump said Abe was a great man.
Trump-san.
And it's interesting because before Trump met Abe, and I remember this, I was here. America was talking. In fact, Trump's platform, when he was running for election, his platform was, we are going to make Japan pay. We are not going to defend them anymore. Our aircraft carriers are expensive. We're going to make Japan pay. If they don't pay, we are leaving. And many American people were like, yeah, stop helping Japan. It's too expensive. It helped him win. Not just Japan, NATO, all these other countries that America's been helping since for 80 years, 75 years or when it was. It helped him win the election because many people were upset that America's helping all of these countries with our military, and they don't pay. Unfair. Bring the money back. Help our economy. And so Trump wins. The Japanese people were afraid. They're like, oh no. Trump is going to pull away the bases and he's going to pull away the aircraft carriers. And here comes China. Here comes North Korea. And we're not ready because we've been relying on the United States for over 70 years. We're not ready. It was a panic. Trump and Abe meet. Oh, we've always been friends. Huh?
Yeah. So I mean, Trump side very smart.
Well, this is I've thought about this for a long time, for years. What happened? Trump, a big briefcase full of money. Now, Mr. Trump, be our friend. Oh, thank you. We're friends. You know? Or what? Trump says Abe was a great man.
Yeah.
Have you seen Trump's head? It's the biggest head in the United States. This guy, he doesn't say good things about other people very often. And for him to say Abe was a great man, it's like, whoa, really? Donald Trump thinks the Prime Minister of Japan is a great man. Why does he say that? I get the sense that when Trump and Abe had their first meeting, by the way, Trump had no political experience. Never been a senator, never been a governor, never been a mayor, never been a city councilman, is not a lawyer.
Yeah.
He's a construction man, he's a real estate man, he's a TV star.
Businessman, yeah.
He has no experience in politics.
Yes.
Other than, like in construction and zoning and permits and dealing with the city council, trying to get a building built, and that. On the other side, he's got experience with politics, not good. Like, I need a permit. I'm trying to build a building and you won't let me, and I'm paying all this tax. He's an outsider. He meets Abe, and Abe's like, yes, in the monetary easing, and talking about Abenomics. And Trump is all ears. He's like, really? That's what you did? That's how you helped Japan? He's taking notes. Wow, this Abe's a great man. If you look at Trump's policies now, it's Abenomics. Right? Tariffs. Japan has always had high tariffs on foreign items. Always. The first time I went to the Meiji to buy cheese, I was like, what? This is double the price in America. It's Gaihin, right? What do you call it? Yunyuze?
Yeah.
It's incredible tariffs. Japan has always had high tariffs. Always. And the monetary easing and the low interest rates and all of that stuff, that's Trump. It's like, here's this political outsider not doing very well in his first term, meets with Abe, comes back to America with all these great ideas. This is Abenomics that Trump is using.
Really good friendship. So
the bases are still here, the aircraft carriers are still here, the friendship still goes on. And the people in America were a little bit upset. Wait a minute, where's the money? I thought we were going to stop helping Japan. What happened? They start thinking Abe gave Trump a big suitcase full of money. But I think he just got a lesson in politics, in international politics, tariffs and monetary easing and interest rates and international partnerships, business cooperations and things like that. And so.
maybe after Abe-san, so the prime minister changing quickly, so the Suga-san, Kishida-san, Ishiba-san, now the next prime minister, maybe the very quickly changing, but Abe-san is a very long span
Yeah.
prime minister, so the
Yeah.
maybe the maybe the Abe-san
Abe
is
the
a
Great.
very reliable and
And then when he died, here goes the yen, right?
Yeah.
Things are much. Of course, there's some other factors. The Ukraine war has been hard on the planet, especially East Asia, because of Russia, Russian gas, and all of that, right? It's tough,
Yeah.
right? Iran is no longer able to sell oil to Japan. Japan was Iran's biggest customer for many, many years.
Yeah.
And now oil is more expensive. Russian gas is unavailable. My dentist can't get palladium because it all comes from Russia. The military can't get titanium because it all comes from Russia. The price of diamonds is out the building. Have you seen the price of diamonds? After the Ukraine war, diamonds doubled, tripled in price. Diamonds. Diamonds, yeah. Yeah. So the Ukraine war, the Corona, all that money that went to Pfizer. I mean, it's been hard times. It's been hard times.
Now that the Tokyo stock market price is very, very expensive. Historically, so the most highest price is now 45,000.
Okay. But my yen is not very strong anymore.
Not strong, yeah.
The price of hotels in Tokyo is out of control. The price of hotels in Tokyo is out of control.
Yeah.
The workers have to pay. The companies can't pay, so the workers have to pay. Well, we will see next month. I hope it's Takaichi. I hope it's fair.
Yeah, maybe the next month
Yeah, okay.
will have.
We got lucky with Trump that he didn't die.
Yes.
He didn't die, and that bullet just touched his ear, and everybody's like, it's a miracle. And even Elon Musk was like, this guy can't lose. I better support him because.
It's a miracle.
Because 4 more years of Democrats and our country would be over. Our country would be finished. America would be gone. 4 more years of that kind of dementia, Nietzsche show government.
Next election is 3 years later, so the next president election is.
And technically, Trump cannot run because 2 terms is your limit. He might not want to run, even if he changed the rules, because there's a possibility that he could change the rules. If he gets enough votes to change the rules, the Congress could come together or the Senate could amend the Constitution if the courts allowed it, right? But then again, one of his people like J.D. Vance or Rubio, Marco Rubio, could be the president. Hillary Clinton was Obama's Secretary of State, and then Obama did 2 terms, and he had to leave because 2 terms is the limit. Roosevelt did 3, and he died in his 3rd. Yeah, that's when they said, no, we can't do this anymore. We got to limit to 2 after Roosevelt. Obama did 2, and then Hillary was the Secretary of State. She's the one that got Japan to stop buying Iranian oil. And the price actually came down because they guaranteed a price. So I thought that was good. One good thing she did. Okay. So Marco Rubio is now the Secretary of State, and he could be the next president after Trump. He's very qualified, speaks fluent Spanish and English. We have a lot of Mexicans in our country. I think a lot of Mexican people would vote Hispanic. We call them Hispanic because they're not Mexicans, they're Americans, but they're from South American countries and Mexico. They speak Spanish. They have Spanish parentage and heritage, right? They would vote for Marco Rubio. So he would get the Hispanic vote because he's a Trumper. People who support Trump would support him. He's highly qualified. He ran against Trump. When Trump was running against Hillary, he had to beat Rubio because the primary election, Trump eventually won against Rubio. So Rubio was actually his enemy at that time. And now he picked him to be Secretary of State. He knows how good he is because you learn how good when you're an enemy. You learn how good they are. Or the vice president, J.D. Vance, could. He's supported by the working class people because he's a working class type person. He was a senator from Ohio. I guess it was Ohio. That's right.
Ohio.
Yeah. He was a lawyer and then a senator from Ohio. Came from a working class family. He supports, labor unions and workers' rights and higher minimum wage, that kind of thing. Middle class economy. He supports that. So maybe a twin ticket, Rubio and Vance, that might win. So Trump doesn't really need to win in 3 years. But 3 years that's a long time. You can do a lot in 3 years. America could really turn around in 3 years. We don't really need Trump again. After America makes this great turnaround, we're good. We're not going to get a Democrat, I don't think, for a long time. They've really messed up their house. They really messed their house up. But it's Japan I worry about. I don't worry about America now. I worry about Japan. Come on, Japan. Please.
Next month it's very interesting.
We'll find out.
We want to change the Japanese market, Japanese culture, Japanese. I hope that such a changing person,
Yeah, somebody that's
very powerful person for the change.
leadership.
Leadership.
Not just business as usual, same old. Like a Gon. The way Gon saved Nissan with change, with leadership. Yeah.
Change. Maybe the next year and the next 2 years later, so the Panasonic's CEO will change, maybe. But basically, Panasonic CEO is a very nearly same type policy, same type strategy, same type policy.
Business as usual. We say business as usual. Business as usual.
If other company come to Panasonic, maybe they are surprised. So the Panasonic's person employees are very similar. The same type.
Mindset, similar mindset.
Same mind, same
way of thinking.
Same behavior, So maybe not unique.
Well, it's a company DNA, right?
Yes. So DNA. So if the next CEO from Panasonic original, not changing the Panasonic, So the another company come to and another CEO come to another company from another company. I hope so.
Oh, that would be interesting. Well, back to Trump, when he won and he had a lot of supporters, over 50% of the population, difficult. His first 3 months was chaos. It was crazy. The stock market was all over the place, and the people were fighting in the streets, riots in California and New York, and it had to call the military in to take care of California, and people were, oh my God, we're going to war with Iran, and look out, China and tariffs and all this. But finally, after 6 months, basically the bombs dropped on Iran. Everything calmed down after that. Once those bombs dropped on Iran, and it's like nobody died.
Yes.
Right? It's like, wow, we made the world safer. We were very careful. We blew up the nuclear bomb machine, and we didn't kill any American soldiers. And then things have been, the stock market's going up. And we negotiate deep trade deals with these countries, and things have finally moving in the right direction. But those first 6 months, it was chaos. It was craziness. So even you get the right person in there, it's going to be a mix-up. People are going to be crying and complaining. Where's my thing? I want my thing. I don't want this new guy. Mommy, I want to go home. Right? Even if it's the right leader, people are going to cry and complain. It's hard. Leadership is difficult. Difficult. People get lazy.
Yes,
and when you just let it happen slowly over years and years and years, it becomes entrenched. It's going to be tough to turn away from that. It'll be so difficult to turn away.
Gradually, so I feels very lazy, so the company's right.
Leadership has a way. I mean, if you think about it, Trump is 78 years old, 79,
80 years old, so
almost. And he's like Mr. Genki.
Yeah, so his energy is very great. So,
And that inspires people. Some of these much younger people are like, what's my problem? Look at this guy. I should motivate you. Yeah, that's leadership. Leadership's motivation.
Motivation.
Yeah.
Leadership is very important. So
Remember Steve Jobs? Steve Jobs would get up there and talk, and the thing, and he'd shut the slides, and wow. Bill Gates never did that. Never. Couldn't. Yeah. Those keynotes, back when Apple would have the iPod and the iMac before the iPhone. And then the iPhone came. It was, wow. Of course, then after that, I was like, oh, well, we have everything we want. Steve, you can take a break. You can die. It's okay. We have iPhones and iPads, so thank you, Steve. And he did. He died, and nobody watches the Apple keynotes anymore. We don't need them because I got an iPhone and an iPad.
Maybe this week, so the iPhone 17 is
Who cares? My 13 does very well.
Very good.
This is an iPhone 10.
Yeah.
And you're still happy, so.
No problem. So the battery power is gradually down. So, but now is no problem. So
you're still good.
Yes. So maybe I don't buy the new one new iPhone.
We're okay.
But I want, but don't buy.
What does your son have a 16?
Yes, so no, 15.
15.
Yeah.
Well, he buys a new one. You can have his old 15.
It's strange. Yeah.
I'd like a 15. That's a pretty nice phone. Can't you get a 15 at the SoftBank, like 0 yen or something? Don't they do that anymore?
So,
Like 2-year-old model. I remember like the full price for the new model, and then like Ichiman yen for 1-year-old and 0 yen for the 2-year-old model or something. They don't do that anymore. Used to be that's the way it was.
Yeah.
The 2-year-old model new contract was 0 yen or something.
Yeah. Now it's no problem. So the 15 is on the same. 14, 15, no problems.
Yeah.
Yeah. 17, the maybe the 20万or 30万. It's too expensive for me.
Crazy. And with the Enyasu, it's crazy.
Okay. Well, thank you very much.
Thank you. I will see you next week, Tuesday.
Yeah, next week is Tuesday and
7:30.
7:30. Yeah.
Thank you very much.
Thank you.
Okay.
Thank you very much.
Take care. Have a good evening.
Thank you very much.
Good night.
Good night. Bye bye.